I think we can admit Innocent, who's one of the panelists. Is there anything else that tech support interpretation is okay?
Yes, interpretation has started.
Good. Because maybe we'll have the French student joining in. I'm not very sure. So let's just, let me just admit him if there's nothing else. I think we also have, this one is also giving closing remarks, I think. Yeah. Hi, Innocent. Oh, we need to make him a co-host. Innocent, can you hear us?
we have thought that students key stakeholders in addressing antimicrobial resistance. If we change the mindset, we increase the knowledge and awareness about the do's and don'ts of AMR, the behavior around the misuse and overuse of antibiotics. We are touching a generation of the future doctors, future lab scientists, future technicians, future engineers. If they start having a basic understanding of antimicrobial resistance, that will go a long way. We've been able to see presentations today that are focused on research that has been done here in Kenya, in Kibera and other regions. We've seen innovations. I mean, students have come up with innovations in surveillance, innovations that would allow us to be able to track patients, track diseases, and be able to optimally use antibiotics, especially as a class that is misused here in Kenya. So it has been an optimistic day for me. It has been very encouraging that, we have actually many students that are engaged, and these students are coming from various disciplines. And so, not all of them are in medical school. No, some of them are coming from a background of engineering, lab sciences. Some are in the agricultural sciences, and some, of course, are in the medical school and pharmacy schools. But they're all coming together, burdened and wanting to do something to stem the tide of antimicrobial resistance.
And we also looked at other aspects of the soft skills apart from just the technical aspects of AMR. And I must say it was quite encouraging to see the students attend. We were having these sessions Saturday mornings, reason being they've been in the lectures during the week, and they would be committed, they would come, they would learn, and they gave a lot of good feedback for the guest presenters that we actually had for these sessions.
This year was just a pilot, and we have been able to learn a lot. And it's a hope that the students whom we have trained in this program will take up the initiative and build sustainable initiatives too in AMR. So the AMR My Turn competition was part of this program, though it was an idea that we thought of with Medical Students Association of Kenya. So we thought of how we can also try to incorporate it into the program. It has been a wonderful event. At least we have been able to show the immense potential that students possess in curbing AMR, and it's a stepping stone for us. We hope that this will be a triggering moment for people to realize that students really have a lot of potential, and support them and give them the platform to engage.
Alongside stewardship activities and awareness, research activities is very important as far as antimicrobial resistance is concerned. Therefore, my urge is to encourage all students maybe to take initiatives in research and innovations. It could be the only possible way to mitigate the threat of antimicrobial resistance.
Going forward, I am mostly motivated to motivate other students to take action, because I believe that together or as a group we can reach out to more people and make further impact compared to alone. And going forward, I'm also looking forward to partnering with so many different students from so many different institutions, because through the leadership program I've met people from Zambia, Uganda, and other countries. So it has really exposed me to the multi-sectorial way of working and curbing antimicrobial resistance.
This project really motivated me into doing my research, and I learned a lot, because being a leader in campus and out there really made me to be creative, to come up with ideas, and I really thank the platform for that.
As a student, I do love doing research, and I am more interested in doing research, especially in areas based on AMR, so that I see or come up with new ways which are yet to be found out and figured on how we can help to curb AMR.
So I'm glad that we had presentations from students across the country, and this is going to cement our efforts in making sure that everybody, the government, the medical professionals, and the general public at large will understand why it's important to play their role in curbing AMR. I'm really glad that after this we are going to formulate other activities that are going to help us in making sure that this conversation does not end at this point.
Antimicrobial resistance, as you understand, it's a multi-sectoral problem. You know, it cross-cuts the environmental sector, the human sector, and the animal sector. The students in this case, they play a critical role because they are coming from different disciplines, and so they'll be able to address the drivers of antimicrobial resistance in the various disciplines.
I joined AMR leadership program so that I can be able to engage to get more knowledge on how to tackle AMR and engage the society in mitigating antimicrobial resistance.
I call myself an AMR champion because I have a personal journey with AMR, and I am really passionate to seeing other people grow and become better and fight AMR, because this is a silent pandemic that is coming to become larger than we think.
Students have a lot of scientific information on infections and antibiotics, bringing it into practice and practicing what we call antimicrobial stewardship with multi-professional teams that was missing. And therefore, the School of Pharmacy, University of Nairobi was a pioneer. Working together with USAID MTAPS project, we came up with the first antimicrobial stewardship curriculum, which now we are implementing at the School of Pharmacy to be able to equip pharmacy students in antimicrobial stewardship. And going forward, we hope to actually now roll this out to several other universities, the medical school, nursing school, dental, and other health professionals.
Before designing the AMR Leaders Tertiary program, we were engaging in some community initiatives and some series of webinars. But after some time, so that such an approach is not so sustainable in terms of nurturing program that can really educate young people and build capacity for a given set of time.
We had students coming from 11 universities in Kenya coming to showcase what they've been doing in categories such as innovation, research, art, and it was very, very encouraging to see the great work that these students have been engaged in. So I feel very motivated myself that indeed we are creating agents for change. Indeed we are creating AMR champions, champions that are motivated to act especially.
I'm a writer of poetry and I use it to do health advocacy. So today we were trying to create awareness on antimicrobial resistance, and the poem was it was called The Silent Crisis. It's something that people haven't known yet, even health professionals, and so I was using the poem to create awareness more about it to the public.
It's a three-dimension game. According to how I have idealized it, it's supposed to have information about diseases and antimicrobial resistance before the beginning of any level. So it will help create awareness outside there to the people who don't know much about medicine.
So greetings again to all. Good afternoon, good morning, good evening, depending on which part of the globe you are joining us from today. And this is a great Friday, a day when we have a side event for the React Africa and South Center Virtual Conference 2021. The side event is actually where we are celebrating an end of years event for the AMR Leadership Program for tertiary students in Africa. And this is an innovative pilot program that seeks to create AMR champions in the African region by targeting the youth, tertiary level students. And React Africa is implementing this program in collaboration with Students Against Superbugs. And my name is Julian Nyamupachitu, and I'm a program manager at React Africa. And it is really my honor to moderate this exciting session today for a stakeholder group that I am personally passionate about, and a very important stakeholder in curbing AMR, these students. So at this juncture, I'll pause for an opening prayer from Alex, one of the students, Alex Akaka, will give us the opening prayer. Alex is a Bachelor of Environmental Health Science student at Makerere University in Uganda. And he was actually, I remember him for always reminding us to pray when we started the sessions that we were doing the virtual sensitization sessions. So you will honor him to give us a very short prayer. Over to you, Alex. Alex, you're on mute. Kindly unmute yourself.
Yeah, good afternoon, good morning, wherever you are. My name is Akaka. As they said, I have a task to pray for us. Let us pray in the name of the Father, the Son, and the Holy Spirit. Amen. Heavenly Father, we gather here today to witness the graduation ceremony of our people, the students. You may come amid us in whatever we do, in words and in deeds. You have given us knowledge and wisdom. To our trainers and organizers for the AMR Leadership Program for tertiary students in Africa, may you give us courage in what we do to fight AMR in our homes, families, community, and nation at large, so that we may be like wise man who built his house on rock. Rain fell, floods came, and wind blew, but did not collapse. It had been set solidly on a rock. As we graduate today, we believe that we preach the gospel of AMR in cities and towns, communities and households. Support us to do your will. And if anyone has complained against another, forgive one another. May your peace, love, and trust lift up our hearts to always follow your will, to support one another, protect and guide our trainers and organizers, students and teachers, political leaders and technical officers, so that they may join hands in the resource mobilization and allocation in the fight against AMR in our society. In Revelation 3, chapter 3, verse 2 said, wake up, strengthen what remains. I ask this through Christ our Lord. Amen. In the name of the Father, the Son, the Holy Spirit. Amen.
Thank you so much, Alex. I move on to my colleague who's just going to give us a recap. As we say, this is a side event of the annual conference that we are hosting as React Africa and South Center, which is an annual event that we have. And we'll just get a few highlights of what the discussions that went through for the past 3 days from Dr. Tracy Muraya. She's a senior policy officer at React Africa. So she'll take us through the key recommendations from those days. Over to you.
Hello, everyone. As you've heard, I'm Tracy Moraya, and I work with React Africa as a senior policy officer. So allow me to share my screen. The last 3 days have been quite eventful. We were privileged to have quite a number of AMR stakeholders join us and make our event quite successful, engaging, and just stimulating discussions. So the 3-day, so this is day 4, but the past 3 days were themed. Each day, sorry, I apologize about that. Each day had a theme, and we started with the high panel presentations on day 1. Then those were followed by day 2's, apologies, there we go. Can you see my screen now? I hope so.
Yes, we can see it.
All right then, thank you. So day 1 was just a high level opening session where we had the regional bodies come and just give high level remarks. And this of course was after we had heard from our directors from both South Center and React Africa and our founder of React Network. Day 2 discussed along financing and preparedness of pandemics. We all know we're going through one right now. And presentations were around the financing bit of it. This was followed by a moderated panel discussion that engaged representatives from the World Bank, Multi-Partner Trust Fund, and the Fleming Fund. Then we had a country AMR financing experience given to us by Kenya, the Kenyan national focal person for AMR, and that ended our day. Yesterday, we tackled implementation of AMR national action plans in the COVID era within our region, and we got a number of country presentations from the countries listed right there, but this was after the ground had been laid by WHO Afro AMR section representative, after which we ended with a facility experience just to show the successes, challenges, and lessons learned from a facility experience. This gave way to breakout sessions, which were quite engaging and informative. From the 3 days, the common themes that came up really were that AMR is a global risk, and as that, it requires multiple or rather multi-sectoral coordination. And that calls for One Health approach. Now, the fact that national action plans are actually plan of plans, it means they're riddled with complexities in resource acquisition especially, and just even the implementation itself. So apart from continued creation of awareness and creation of understanding, there is need to strengthen infection prevention and control and WASH systems, and also stewardship programs to delay emergence and limit transmission of AMR. There is need to strengthen health systems to improve surveillance and impact of AMR in the region, hence to bring about and to really solidify the political will that we need, and so that also just ensures that resource mobilization is always a part of the implementation process. And then I think there was an agreement that really there is a tangible link between COVID-19 and AMR, and that way then we need to identify and synergize efforts and use internationally recognized tools such as the International Health Regulations tool, which links pandemics, and even this one that is, it can slowly get AMR to be recognized for what it is, that it is actually a pandemic that needs great attention. Then finally, the way forward, I chose to categorize this into 3: political commitment, NAP development and implementation, and community engagement. My take from the event is that the 2 on each end, political commitment and community engagement, really blanket and surround the development and implementation of our national actions. While the plans environment, we have low data to inform our implementation and even development, we need to be joint and just mobilize everything, resources, everything else, jointly integrate programs and continuously monitor and evaluate. But this will only happen when our policy makers are actually cognizant of the fact that this, and at the same time, the community is aware and understands what AMR is and what each and every one of them, which role that they play in contributing to the development of AMR. So with that, I wish everyone a fruitful event and congratulations to the students. Over.
Thank you so much, Dr. Tracy, for that. And indeed, she ended with reminding us that everyone has a role. When the NAPs are country-owned, the country means us, not the country does not exclude us. So as students, again, it's a reminder that all the steps that you're doing continue, because you're actually contributing to what the country would want to achieve in terms of the goals in the national action plans. So at this juncture, I'll move on to our director, who is going to give us the opening remarks for us to start the session today. So Dr. Mefin Mpundu is the director of REACT Africa and the partnership and stakeholder engagement lead for the International Center for Antimicrobial Resistant Solutions, ICAS, responsible for Africa. He is a registered clinical pharmacist and public health specialist with over 30 years extensive experience in global health policy and security. He's a global advocate for AMR and equitable access to healthcare, and is passionate about providing multiple stakeholders with technical support in AMR National Action Plans development and implementation. And he's been very instrumental in actually providing strategic leadership for this program. So over to you, Dr. Mefin, to give us your opening remarks.
Good afternoon, everyone. I hope you can hear me.
Yes, we can.
Oh, you can. Okay. Let me pull up my my presentation. Just a minute. Yeah, it's quite a joyous occasion to be able to witness a program that was conceived between SARS and REACT Africa. SARS is Students Against Superbugs. We've been collaborating with them over the years, and this was a flagship program that we conceived together that wanted to focus on students in tertiary schools or institutions. And so we actually had lots of students that applied for the program from many countries in Africa, but we could only select a few students that we focused on. I think about 100 students or so that we actually focused on. So without much ado, this is a celebration of the dedication, the commitment of the students who've gone through this program. They were students who joined us every Saturday. We met with them. We dealt with topics that were varied. One Health topics on AMR and universal health coverage, AMR in research, AMR, raising awareness of AMR by using art, literature, research, poetry, and other means. And these students went into the communities in which they were able to implement a number of these programs very effectively, engaging with older folks in communities, engaging with the younger folks, using sport as a means of communicating antimicrobial resistance. And so this is a culmination of very hard work of these students that I'm so much proud of. Proud to have been part of this program and to have actually supported it, and especially special thanks to Julian. Special thanks to our colleague at SARS, who has worked very hard. We'll have some words to share. Just a quick recap. I think we've spent a week looking at this issue of antimicrobial resistance, and we've done that because we are dealing with a very active volcano. It's no longer a silent pandemic. It's a real pandemic that is affecting millions and millions of lives around the globe. The rise of AMR is indeed a global crisis, and unfortunately, the momentum to address AMR is not where it's supposed to be. We are losing very active molecules at a very rapid pace, and we've not had any new developments of any antibiotics of new classes over the last 3 decades or so. And so we are really diminishing the resources that we have. There's a sense of agency in which we need to act, and we need to act now. Otherwise, we will not have any treatments for tomorrow when we develop any infectious diseases. The infectious diseases that we used to treat in the past, and simple infections like upper respiratory tract infections, UTI, are becoming very difficult to treat. And that's why we spent the last few days to try and see what we can do as countries, as civil society, as researchers, as communities, as governments, as international government organizations, and as a global community in terms of addressing antimicrobial resistance. Antimicrobial resistance, as we all know, it's a very cross-cutting, complex, wicked problem that affects not just the human health, but the animal health, the environment, and it does actually affect even terrestrial and aquatic animals. We know now very clearly that the achievement of sustainable development goals that we have to achieve them by 2030, the fact that we wanted to end poverty by 2030, the fact that we wanted to end hunger by 2030, the fact that we wanted to address health and ensure that every citizen under the globe can have access to health when they need it, when they require it, without really posing risk and getting them into poverty. The fact that we wanted to end tuberculosis, we wanted to end malaria, we wanted to end HIV by 2030. The fact that we wanted to strengthen, really our industries, industrialize our countries to a level where, we created employment, we raised the standard of living of our community members. The fact that we wanted to reduce inequalities by 2030, all these, my dear friends, are really threatened by antimicrobial resistance. And that's the reason that we really need to respond and take this issue very seriously. We need to accelerate our progress in our countries. We need to find innovative ways of addressing antimicrobial resistance and ensure that we secure really our future. We need to collaborate across sectors, because one of the challenges that we have is that we are not working in a collaborative way to address antimicrobial resistance. We need to invest, local investment and future investments into a sustainable way of responding to antimicrobial resistance. So without addressing it, clearly we see that, really most of the standard development goals are not going to be achieved. And unfortunately, that would be a sad thing for us to see in this day. And one other thing that is important to say is that, there are a lot of people who die from lack of access and antimicrobial resistance itself. So what has REACT been after, action on antibiotic resistance? One of the things that we have done since 2014, when REACT Africa was formed, is that we focused a lot on supporting countries with development and implementation of national action plans. We've been very active in many countries. We've supported Nigeria, we've supported Zambia, we've supported Kenya, Malawi, Ghana, Uganda, several countries that we have contributed to in terms of really helping them develop these plans, be able to prioritize, and in some countries help them with costing of the NAPs, and in some countries where we have actively been very active in implementation. We are piloting antimicrobial stewardship programs, for example, in Kenya and in Zambia, and we actually have our React annual conference. That is a great platform that brings together people from over 30 countries as one of the areas that we focus on in terms of movement building. We've developed a lot of resources in our toolbox, resources that can help you start a campaign, address the 5 strategic areas of the Global Action Plan, raising awareness, for example, and knowledge on AMR, addressing issues of surveillance and strengthening the knowledge that we have, addressing areas around infection prevention and control, addressing areas around optimal use of antibiotics, and really supporting and investing in research and development. We've been very active in contributing to the regional response beyond the national response. At the region, working with the tripartite and other organizations to actually render our voice and support the regional and the global governance. We've been very active at the global level to ensure that the voice of the South is actually amplified, and that the voice of the South actually, is listened to and heard at the global level. We have very little funding at the moment that is coming into our countries, and this makes it very challenging for us to address these 2 current pandemics. The COVID-19 pandemic and also addressing the antimicrobial resistance pandemic at the same time, making this very challenging. We have also focused on really public health driven innovation by providing solutions, by being involved in research, by being involved to challenge students to come up with great innovations that can address antimicrobial resistance, and by being very active in contributing to the dialogue and offering solution around research and development from desk up to the patient bed. And so we've been very active in these areas to actually continue discussing this dreadful and this wicked and this problem that is very complex for us to address. React itself was established in 2005 and has got it's got 5 regional offices around the world, 1 on each continent, as you can see on this slide. So then we come to, why did we decide to focus on students? Why was that our focus group? We began doing this actually as early as 2015 when we started developing, for example, information, education, and communication materials that focused on students, that focused on politicians, that focused on students in tertiary institutions, and that focused on communities. And so we wanted to focus on students because, for many obvious reasons, they are agents of change. They've got the energy. If we can change this generation to start thinking and considering antibiotics as really a common resource, that can easily be lost, then we'll be creating the next generation that is responsible and that is committed to ensuring that these molecules that we have can continue working for many, many years. And so, we know that they are really a great key stakeholders, and they are coming from different disciplines and different sectors. Even the students that we had in the program, some came from health, others came from business, others came from engineering, others came from computer science. And so we had students across disciplines that participated in these programs. And if we can really get the students going, if we can fire up the students, if we can build the capacity, raise their knowledge and understanding of antimicrobial resistance, we can achieve more. So that was one of the reasons that we really thought of focusing really on students. And when we had discussions with the students against superbags, one of the things was obvious that, they were also passionate about the student work. We were passionate about that. And so how did we now start engaging students and communities? One of the programs that we have been piloting in Kenya in 2 counties is called Alfoha. Educativa. It's a concept and it's a model that we adopted from Latin America that focuses on children in primary school. on children that I mean 6, 7, 8 years old up to 12, 13, and it uses food, it uses art, it uses drama to communicate and educate these young people on issues around infection prevention and control, on being good stewards of antibiotics, being able to not take these antibiotics unless the doctors have, they've prescribed, and being able to be agents of change in their own communities. And some of the innovations that these kids did was that they were able to develop, for example, touchless taps where you've got a bucket. You've got a bucket and they put some wires where you could actually step on and the bucket would turn and water would come out with you not touching anything else, but being able to clean your hands, without touching anything. These are sort of implementations and programs that have been quite successful. And we've been working with the government, working with the Ministry of Education and the county governments in terms of addressing, and building this sort of raising awareness at this level for students. Of course, COVID-19 had really a disruption in our program, as we had quite a number of students, schools that were closed and we could not continue. So then we developed, we sat down again with SARS to say, so how do we now tackle in a unified way, tertiary level students, not just focusing on pharmacy students, on nursing students, or those that are in medicine, but we wanted to really bring in students across the board that were doing various disciplines. So we started forming clubs in these colleges and universities. And the whole reason, some of the activities that we did were to really sensitize the students, be able to build and encourage and grow their level of knowledge, to be able to use them to affect their local campus, as their local community, but also to extend into the communities themselves. We had virtual sessions that we had with them where, they made presentations. We had experts from different sectors that talked with students. And of course, we had the climax of activities that happened in the WOW Week, where we had students really do a lot of work around, around Africa, in different countries. And these slides actually show you, these photos show you some of these wonderful activities that the students were engaged in. And of course, one of the challenges that, is really sustainability of student activities. It helped us in the sense that it led to the idea of really developing an AMR leadership program, which we called, AMR Lab, that React Africa is currently actually piloting in collaboration with the Students Against Superbugs. They've been our partner on this particular project. And what has this project really focused on in a broader sense? It's been all about empowering students, leaders in Africa, who are problem solvers and solution providers for AMR globally as a health threat. And these, of course, integrate into communities that they are in. We also, had 3 major objectives for the program. One was to target young people, to increase their knowledge and also have them capacitated to be AMR leaders, both as students and in their careers thereafter. Secondly, it was to provide and develop a sustainable programs for engaging students in AMR throughout Africa, and so that it was not limited to only one country or one region. The third strategic really objective was around knowledge and skills building that are necessary for active and effective contribution in developing, implementing, and supporting interventions of antimicrobial resistance, looking at infection prevention and control through stewardship, through supporting research and development, and through supporting innovative ways of raising awareness in communities. This is, the ratio of applications that we got when we started. Like I indicated, we received over 300 applications, from Zimbabwe, from the UK, Zambia, Tanzania, Ghana, Kenya, Liberia, Nigeria, and Tanzania. And, and so they wanted to join the program. It was a very competitive process. And so we could only take, like I said, only slightly over 100 students in the this first year, which was the inaugural year. And then next year, we hope to take more students and mentor them, because we really mentor them and work with them. So what has been the progress today? 100 students registered in the program from 8 countries. The official launch of the program was in July 2021. We started with a baseline assessment to actually gauge where the students were in terms of their level of understanding, in terms of what their engagement was around AMR, in terms of what their commitment and what their communities are really understanding was. And then we developed the AMR course that was done during the first month. So this was an intensive course just on antimicrobial resistance. We also engage students in various, we expose students to a very holistic way of looking at antimicrobial resistance. And for Kenya, we had a great event that we had in October, which was, which was entitled My Turn. It was a competition for several months in which students, did research. They studied their community utilization of antibiotics. Some worked in the slums, others worked with schools in sport, others did research, that was contributing into their master's program and also into their dissertations. This actually culminated into an event that we had in Kenya called My Turn. It's My Turn. And the students, it was amazing to look at various areas of research, to look at theater, medical students and dental students presenting all these. It was very, very exciting. And that was done in collaboration with the Medical Student Association of Kenya. Really quickly, this will be an annual event. We will expand and do similar annual events in various African countries beyond Kenya, and so that we can have this sort of what. There were also, personal reflection essays. They provided those, and then of course in the WA activities, they went into communities and to really raise awareness. And then of course, they worked on their project proposal submissions for next year, 2022. And today, we actually are having a virtual graduation ceremony in which I would like to congratulate all the students. They worked very, very hard, and really, they all deserve our applaud and our congratulations. And as I try to close my presentation, these are some of the topics that we looked at. I will not read each and every one of them, but I would just like you to see that, we have actually taken a very holistic One Health, looking beyond boundaries of the 3 major sectors to actually address antimicrobial resistance. We've developed their capacities in project development, project management, in systems thinking, around AMR. We've developed capacity around monitoring and evaluation, and and we've addressed several issues. And today we witness the graduations of these wonderful 100 students. This slide shows you again just how diverse we had speakers coming from. We had speakers coming from all over Africa, and some of the speakers actually came from, from Italy. We had Dr. Cavalli from Italy present to our students. We had actually accomplished scientists that were able to present. I mean, Dr. Gitau, Dr. Raphael Chanda, all these guys were able to present to students on different issues. And so it's been a great event. My turn was a challenge to each one of us that, it's my turn to do something about AMR. And probably this is the call to action that I really would like to end with. My turn brought students who really spoke to it. And you can see, for example, on the left side, our lower quadrant of my slides here, that's research. Those are abstracts of the research that they did, and you see that whole photo of students we took together. I was grateful to be able to grace their occasion and to listen to their passion, their commitment, their dedication. That was actually marvelous for me to have been part of, and so proud that of each one of these students. And I really wish them, some are graduating, wishing them the very best, and that they can continue to be AMR champions as we go forward. We also have in REACT what we call Innovate for AMR. It's a program that is run by REACT North America, where we challenge students in tertiary institutions to come up with, with innovative ideas of actually addressing AMR. It's a global competition, and we were so proud that there were two teams that came out of, out of the African region that that way finalists. And Team Apollo, for example, it was a team that consisted of 3 medical students from the University of Nairobi, Kenya, who were keen on the multi-sectoral concept of healthcare delivery systems at the hospital level. And their plan, they proposed really solutions at bridging the gaps in the first innovation pillar through curbing the spread of infections within hospitals. They intended to develop a technology-based surveillance system that was geared towards promoting epidemiologically sound surveillance within our local settings. And we also had the team that came out of University of Nairobi and Panskala University in Indonesia. And so this team of Dennis and Nesha, who actually undergraduates, they chose the second innovation pillar, to propose integration of interprofessional collaboration between healthcare students and professionals, revitalizing community health facilities, and short message service reminders to run medical checkups and vaccination programs. These would be text messages reminding people to go back to the hospital and all that, and they hope that this innovation could actually be implemented in low and middle income countries in order to reduce the risk and preventable infectious diseases. So these are some of the programs that these students from Africa, from Kenya, were among the finalists globally, and that's a great feat. It's a great achievement. Congratulations. Already some of the things that we are seeing in terms of success stories is that we are following the training and sensitization sessions. A number of students have taken on various initiatives in their respective countries, working in different areas of their communities and their sphere of influence. A few present examples today of their great work, and there's need to actually sustain the efforts and be true AMR champions even as you transition in your professional career. And I would encourage other funders to really join us in this work, in this really flagship program that we have with SARS and we're doing with REACT. So what's the way forward? REACT will continue partnering with SARS Africa and other partners who would like to continue the AMLEP program, which we think is a necessary and integral program in the region. The lessons learned from these pilots will help us to make more informed decisions and target interventions. And we really want to feel free to reach out, feel free to reach out to us as we are available for mentorship, technical advice and support. We don't just support government at policy level, but we are ready to support students at a granular level, at a community level, and work with them. Congratulations, graduates of class 2021. Thank you so much.
Thank you so much, Dr. Meffin, for giving that summary of the program. And at this juncture, I will move on to just share a few lessons that we have learned before we hear from the students themselves, since today this is their event and would want to hear more of what they have been doing. So just continuing from what Dr. Meffin was talking about in terms of what we are trying to to achieve? What are the results that we want to see? As we're going through the sessions, we did have a midterm evaluation that we sent out to the students just to gauge whether whatever we were doing, whether they were actually gaining anything from the sessions we're doing and the activities that Dr. Murphy was alluding to. And I'll just display a few of the slides of what we got from that midterm evaluation. We started with a baseline assessment, and we'll also have an end term one, which we'll also share in a report for the program, so that anyone will be interested to also know whether how we were doing in terms of also our MND will be able to see that. So here we'll see one of the questions that we asked in that midterm evaluation was to just gauge whether they've learned anything from the program sessions. And we actually managed to see that there was a lot of learning that went through. Of course, I won't go through all of this. We'll also share when we do the final report. And we'll also have a site where you can go in and also see the profiles of the students and what they've been saying. But we also asked them what sessions, the sessions that were displayed in the previous presentation, what they felt, because we want to make sure that whatever we are doing, even in this program, we get feedback as to how well we have done. And it looks like One Health was actually the session that they enjoyed the most. And I think Dr. Murphy alluded to the fact that this is a multi-sectorial problem that really needs different multidisciplinary stakeholders to come on board. So it's good that the students actually understood that the One Health approach is the way to go before they even transition to their professional careers, because it's been a challenge, as we all know. What have you been inspired to do? They did talk about things like advocacy and research, to be a champion, to utilize the knowledge and skills to develop programs that will help in solving health challenges facing humanity, and things like to think critically, because there was design and systems thinking, as was highlighted as one of the topics that was there. So to put what I have learned into practice, very important, because the idea is from this, we are expecting that at least it transitions to actually have them acting and not just getting the knowledge and then not using it. And we also asked how they would describe this program. That's what we got. You can see the responses in that word cloud: educative, impactful, enlightening, timely, which is good that some actually thought this is something they needed, and revolutionary, amazing, and exciting, informative. So that was good that we actually got that feedback. So I'll end this very short presentation with some of the lessons that we learned so far in the program. I think when we started, we actually did do a SWOT analysis together with students against superbugs, where we're trying to look at what we were doing in terms of engaging the students, where were our strengths, where our weaknesses, and what opportunities did we have. Closely, what came out very clearly, I think, as alluded to by our director, was that there was no sustainability in some of the activities we're doing, where we're just having webinars, different students attend, but what do we then do to make sure that something happens after they are sensitized? After COVID-19 happened, it meant that the physical events we had actually lined up together with Students Against Superbugs, we had a full calendar for 2020, starting from January to December, where we wanted to go to different institutions, specifically in Kenya. But because of COVID, we could not do that anymore. So we changed in March of 2020 to now focus on having online sessions, the webinars. So from those webinars, we realized when we advertise, we are now not only getting students from Kenya, but we had interest from the other East African countries and even beyond just the East African region. So from that, we then thought it would be good at least that was actually part of what informed this. So I think just as a lesson learned, we should leverage on the lessons from COVID-19 in whatever activities that we are doing, so that we try and even further look at how we can change whatever interventions that we'll be doing. And the other key lesson that we got from the program was that we know enough to act, and act within what we have. The students really told, they actually, on a personal level, I actually learned that you can do so much without a lot of resources. For example, there are a lot of low-hanging fruits that are there. And during WOW Week, we had challenged them to come up with interventions in their different countries. And with very limited resources, they managed to do very, very good work. I think we'll share a very short video that shows some of what they did. Some were actually coming up with IEC materials, handwritten ones, trying to just make sure that the message gets to the community. So that was really a key lesson, to say sometimes we tend to have excuses that, of course, resources are scarce. Of course, we do not have enough resources to actually actualize some of the activities that we'll have in our work plans. But sometimes just thinking outside the box can actually have us do these activities. Students are creative, committed, passionate. That is something that we actually learned. And they have the drive. They are energetic, as Dr. Meffin said. So I think as great agents for change in the communities, we need to support them and leverage on the efforts that they are doing. So sustaining efforts, the major challenge, not just during WOW, but going forward. So yeah, I just thought I would just share very quickly some of the lessons, but of course in our end of this pilot program, of course it continues because the students submitted some project proposals, which we are currently reviewing, and we'll see how best to support them come the next year and also engage them. We continue engaging them and also getting on new ones to join. So I'll stop sharing now and we get to the part where we really need our real presenters to come on board, the students, as this is their event. I'll call upon our first student who will give us their presentation. The first one that we have coming is Rogers Sinyonjo. He's from Uganda, Busitema University. Rogers is a medical student. He's actually a fifth year Bachelor of Medicine and Surgery student at Busitema University. He'll give us his reflections on what he has learned from the program, specifically touching on the World Antimicrobial Awareness Week activities, where he managed to actually do a lot of activities. So before I hand over the floor to him, I'll just want to, because I see there are a lot of people who then joined in after even our keynote address, after we had welcomed all participants. So we were really welcoming you all, and please, let's have a joyous occasion today as we congratulate these students. So Rogers, the floor is yours for 10 minutes. We are slightly behind time, so if you can stick to the 10 minutes, thank you.
Thank you very much, Madam Dorian. Please, my network is not very clear, so just can request that you confirm you can hear me. And just in case I start breaking along the way, please let me know as well.
Yeah, we can hear you, Rogers, loud and clear, and you can also see your slide. Thank you.
All right. Thank you very much, Madam Julian. And I would like to first of all greet everyone who is on this call. Thank you very much for gracing this occasion in your dignitaries. Thank you for being here as a witness as graduating from this program. My name is Roger Senyonjo from Busitema University, Uganda. I'm doing my bachelor's in medicine and surgery, and I'm in my final year. God willing, I'll be finishing my course in the next 2 weeks. Presenting right from Bali, where my university is. And I would like to start by saying thank you very much to React Africa and South Africa for this opportunity that you gave us. My presentation today will be focusing on World Antimicrobial Awareness Week 2021 activities, which I managed to participate in fully and engage in a number of activities. So I learned about this program, the Antimicrobial Resistance Leadership Program for tertiary students in Africa, in June this year. as I was attending a symposium at Wisdom University that was organized by USAID MTAPS. This is an organization that also targets different students in different universities, make them stewards and champions of change in regards to antimicrobial resistance. So as I was attending that symposium, someone shared the opportunity and having a background knowledge about antimicrobial resistance, because this was not my first time to be engaged. I looked at this as an opportunity to learn more and to actually get a chance to interact with other people and have an impact in my community. I remember in 2018, I attended the national microbial resistance conference that was organized by the Ministry of Health in Uganda. And that's when the National Action Plan on Antimicrobial Resistance for Uganda was launched. So I happened to be part of that occasion. So this program, I should say, it has really been a very wonderful program. We've learned a lot of things right from the basics of bacteria, and the other microorganisms, looking at the discovery of antibiotics, looking at their action and mechanisms, and looking at how antimicrobial resistance comes up. We've learned about the One Health approach and how to have everyone on board, that intersectoral collaboration. We've learned about national action plans. I remember one time, one of the speakers actually managed to take us through how they come up with these national action plans, that whole process. We've learned a lot regarding leadership skills, and we've actually had hands-on experience in regards to leadership. Personal branding, we've learned about critical thinking, that design thinking and system thinking, whereby you don't just draft a project, but you think about the creative ways in how your project is going to create change and have an impact. Research, project development, implementation and management, all those have been really wonderful learnings from this program. I've had a chance to engage with fellow students from across Africa, and I should say, I've really been inspired by everyone. The energy, the creativity, the teamwork, selflessness, and sharing of ideas and opportunities exhibited in this group has been really a wonderful one. And I should say, you know, I joined when I thought I was good, but when I joined this program, I met really good people, and I will always treasure this opportunity that was given to us. As far as sessions are concerned, I should say React Africa and South Africa have been really very organized. I should thank our coordinators, Madam Julian and Daniel. The sessions have been very organized and well coordinated. We've had sessions where we go into breakout sessions. We get a chance to discuss, we get a chance to lead those small groups. And you know, whenever you lead those small groups, that is always the start of leadership. And whenever you discuss with your colleagues, you actually get to learn more and more. Speakers have been well informed and very knowledgeable, and these have been experts who have been able to share their experience and their knowledge with us. Having students also engaged in presentations. I remember when we were finishing the first part of the program, we had a session whereby we were given opportunities, me inclusive, to offer presentations regarding what we've learned so far. And you know, whenever you give a student that chance to go and present, it gives them that ability to go and think, to go and not just attend the session, but have that critical thinking, make sure that they bring out the best out of them. And I should say that was really a very good approach towards this. And then sessions giving a practical overview. I remember one time when we were learning about projects, Madam, one of the key speakers that were invited, she was talking about the project that they were working on, or that they worked on, which was involving basically children, little children. And I should say that was a very good practical example to give us an insight in critical thinking, so that we also learn to come up with very creative projects. The assignments that were being given, they were well coordinated assignments, very relevant. And you know, whenever you give someone an assignment, they could stimulate thinking and reflection. You go back, sit down, as you're making that assignment, you try to think back and try to appreciate what you learned in the program or during the sessions. And personally, as a leader, this program has really nurtured me very well. I'm a student leader at Wisdom University. Actually, right now, I'm the Minister for Justice and Constitutional Affairs and the Guild. And as a leader, I've been able to learn more about leadership skills from this program. Leadership skills, leadership and personal branding. I remember that session was really a very great one. That day I was in theater, but I had to first leave the surgeons, whatever they were doing, so that I can attend to this program. And I should say, right now, my leadership skills are not how they have been. And good enough, I've been able to exercise some of these skills, especially during this World Antimicrobial Awareness Week. We've had a chance, I've had an opportunity to lead a team. I have a team of people that I've been working with on project development, World Antimicrobial Awareness Week, research proposals, and I've been leading this team, and it has been really a very great opportunity for me as a leader. And that has enabled me to appreciate the importance of teamwork, personal branding, and then I've also been able to appreciate the challenges that come with leadership. There are sometimes when you as a leader you have to go an extra mile to make sure that you address or you think about the solutions for the challenges you're going to face. Sometimes even the people you lead might not be on the same page with you, but you just have to navigate all ways to make sure that you bring out the best out of them. A leader always brings the best out of the people that he leads. Our confidence has been boosted by this program, creativity, and leading by example. So basically, that's it about the program, but I beg to move forward to the focus of my presentation, which is the week, the Antimicrobial Awareness Week. So I would like to give a summary of background. First of all, we all know that this year's theme was spread awareness, stop resistance. And that is the theme that we rotated around as we were drafting our program, our different activities. University Antimicrobial Resistance Stewardship Committee, which I lead, of course. And we had sat down, drafted a concept about the different activities that we can carry out during this week. And when the week actually came, it was easier for us because we were already prepared. I have a team of about 5 people that I work with at the university. So we know that antimicrobial resistance is a complex and requires complex solutions. So we have to actually do critical thinking so that we come up with a little bit of creative ways in which we're going to deliver these messages, because it's all about spreading awareness. So I worked through the committee that I've told you, and I've also had a chance to partner with other people and other organizations to make sure that we bring the best during this week. So we had a number of activities running from 18th to 24th of November, 2021, and we targeted various populations, not just one. We looked at the young people, we looked at the health workers, the students, the ordinary community members out there, people who don't have that background medical knowledge, as well as other professionals. And our aim was to increase knowledge on antimicrobial resistance and the actions that can effectively control its spread. So we basically had 3 objectives for this week. The first objective was to increase community awareness regarding antimicrobial resistance and how the actions of individuals, families, and professionals and communities affect the spread of antimicrobial resistance. We know that antimicrobial resistance, it is multifactorial, and everyone actually has, in one way or the other, contributed to the development of the resistance. The second objective was to increase commitment to antimicrobial stewardship among health workers and medical students at Mbale Regional Referral Hospital, which is our teaching hospital, and Western University, respectively. So we also carried out some activities that we are targeting this very group, and here we went a little bit local. In our activities, we were a bit international and a bit local. And then the third objective was to inspire behavioral change towards proper use of antimicrobials among community members. Of course, that was the overall need for these activities. So among the activities that we did, we had activities every day of that week from 18th to 24th. Just outline them out here. On 18th, that's when the week started. We had a launch of our week with online awareness campaigns, personalized flyers, and placards. You will look at them in the next slide. But basically what we are doing here is that we used a number of various social media platforms, Twitter, WhatsApp, LinkedIn, Facebook. Make sure that we target especially young people who are really using these social media platforms. And we used a personalized flyers whereby people could send in their messages. And whenever someone sends their messages, it's like a commitment. Make sure that they actually fulfill whatever they have put in that message. On the 19th, that was a Friday, we went on with our activities. I had a talk at the Rotary Club of Stima University. I was invited as the guest speaker, and the topic was antimicrobial resistance, challenges and possible solutions or potential solutions. I had over a 1 hour talk to those students, basically students and some other community members who usually attend those fellowships. And I managed to really give very good presentations. And it was more of an interactive session whereby I had to get feedback from the people that I was presenting to. After that session, I
Rogers, you
also had
have,
another discussion.
sorry, Rogers, you've got just a minute to go. So I hope you're wrapping up now. Thank you.
All right, I'm going to be a little bit brief now as I proceed. On 19th, we had, that very day after the talk at the Rotary Club, I had a Twitter space discussion where I also presented. On 20th, it was a Saturday, we were hosted at Ergon FM in Mbale. We had an opportunity to talk to the community members. And after that, we also had a virtual panel discussion on microbial resistance, where we had keynote speak from very, very, really highly qualified professionals. On 21st, on a Sunday, it was more of a resting day, but we continued with our online campaigns. On 22nd, we did poster printing and pinning at the hospital and the university, posters having different messages. On 23rd, we had a continuous medical education at Mbayo General Hospital, which was attended by 100 participants, including students and doctors and other health workers. And we had here a clinical picture of antimicrobial resistance. And then on 24th, which wrapped up the week, we had a 5-episode series of short videos providing overview on AMR released. And the results from this is that we believe that those activities increase the knowledge of the participants, and this will lead to positive change, especially towards the use of antimicrobials. So this one shows some of the activities that we did. If you can see just here, where I'm putting the pointer, we are at the radio station presenting. This was a Zoom session. This was some of the doctors who attended the CME. These are some of the placards, students holding the placards. You can see it again here. These are some of the posters that we printed and pinned. These are social media awareness campaigns. This was a Judah space, and you can see I was the speaker at that moment. This is the banner that we printed for our activities. Here I was presenting at the Rotary Club. Yeah. Among the challenges that we faced as I wrap up, business academic schedules really were an impingement, but we tried to create a balance, lack of commitment from some of the team members, and we didn't have really enough professional guidance because the supervisor that we contacted was a little busy at that time. Inadequate funding to carry out the activities in the best way possible. And some students thought we are doing these things for monetary benefits, and some of activities were not done. For example, we had organized the hike, which was not done. The lesson is that we learned from this. One is appreciating the importance of teamwork, because as an individual, I wouldn't have done this alone. Leadership skills and learning and problem solving was also a very good lesson. System thinking and design, project planning, implementation and management, importance of partnerships and lobbying. Actually, I managed to lobby some funds from React Africa, which were minimal, but they really helped us in implementing some of these activities. Thank you very much, React. And then working under no supervision to deliver the expected results, because that's what we did. And moving forward, this is the last presentation. This is the last slide. I intend to do the following. One is to work on the implementation of the Little Angels for Antimicrobial Resistance project. This is the project that we drafted with my team. My team is having some students from another university, and we are using little children as well to implement our project, to carry out that project. Then carry out a research for a proposal already in place. We have a research proposal that we drafted, and we just need to move forward in carrying out the research. I would like to offer mentorship to the upcoming champions, because right now I consider myself a champion already. And then create more partnerships with individuals and organizations, engaging more in creative projects and research, both basic and advanced, and then engage in policy discussions, advocacy, and ensuring social accountability. And lastly, this is some of the most important things I would like to do, is to create an African young antimicrobial resistance champions platform. And this could be something like alumni from this program, because it's going to be continuous every year, as far as I know. So we shall engage more in talks with Madam Julian, Daniel, and my colleagues on how we can create this. And the support needed in this one, I still need more mentorship and supervision. I'm finishing up, Madam Julian. Partnerships with different stakeholders, opportunities to engage in microbial aware activities, and work with organizations like React Africa. If I'm given an opportunity, I'll take it up with a good heart. We still need some financial support to carry out the research and implement projects at hand, and then cooperation from my colleagues as I work towards forming the African Young Antimicrobial Resistance Champions platform. Thank you very much. As I finish, my quote is, working together is the only way we can effectively fight antimicrobial resistance, knowing that everyone has a role to play, and putting young people at the front line. That's my personal quote, Sergeant Rogers 2021. Thank you very much for the opportunity, and congratulations to my comrades. I beg to submit.
Wow. Thank you so much, Rogers. That was an excellent presentation, really highlighting all what you learned. And it's good that you have even enhanced your leadership skills. And we really need political commitment in AMR. So with such young leaders, I think the future will be bright. And the importance of teamwork, you did highlight quite a lot of key lessons there. We will share this presentation so that even your colleagues can also learn from all the lessons that were there in your as you were doing your interventions after this program. So thank you so much for that excellent presentation. I'll move over to Lucy Gatitu. Lucy is a student from Kenya. She's actually going to talk about the My Turn event. Lucy will just give you a few minutes in the interest of time. Lucy is a Bachelor of Veterinary Medicine student at the University of Nairobi here in Kenya, and she's in a second year. So over to you, Lucy.
Thank you so much, Julian. Are you able to see my screen?
Not yet, but we can hear you.
What about
Yeah,
now?
we can see it now. You can just put it in the screen share mode.
Is it visible?
Yes, it is, Lucy. Please go ahead. Thank you.
Thank you so much. Thank you so much. Good evening, good morning, and good afternoon, everyone. All protocols observed. I'm Lucy Gatitu, BVM3. I'm in BVM3, third year of my study in University of Nairobi, Kenya. Currently presenting from Kenya, Nairobi, Kenya. I got to know about this session through a link sent in our WhatsApp group, and I participated by enrolling through writing the essay, which I was chosen to join the program. It has exposed me to so many information about AMR, the challenges about this silent pandemic, which I wasn't aware of. Or I had just given a blind eye to. My knowledge and understanding on AMR has immensely increased. Thank you to the program. I enjoyed having the breakout sessions with so many students from Africa, from Uganda, from Saddam, Precious, everyone else. I really appreciate everything. Through this, I was able to participate in the Maitan event, which happened here in Nairobi, Kenya on 30th October. And the event was elegant, enlightening, and it left an indelible mark in my life. It was my first time actually to present in front of a large number of people, not to mention compromising of researchers. It was so momentous for me. There were so many awesome activities done, from skits, from lit drama skits from Moi University, from great innovations like 3D AMR games, so many captivating research studies, showing so much effort and knowledge. And one that caught my eye was done by a colleague from JKUAT, Jomo Kenyatta University, on antimicrobial resistance by sanitizers. Actually, I didn't know that sanitizers contributed to antimicrobial resistance. And now when you're out with my friends, when you're eating maybe samosas, mandazis from the street, and you have to pour sanitizers on our hands, I have to remind them that just use water to wash your hands, because from that day I learned that sanitizers do contribute to antimicrobial resistance. Mm. As a student leader, actually, as a class representative and an AMR champion, the teachings from the program, that is intellectual thinking session, increased my problem-solving capacity and also helped me to realize my location, analyze my location, and apply the teachings on antimicrobial resistance. And that is how I came up with my research study. During the inauguration of these project on 16th July, we were out for our themed attachment program, and I was attached in a veterinary laboratory lab. And so this program was so relevant to my life back then, which it is even now. The program has impacted my life more than academics, boosted my confidence and my creativity. The leadership session was so impactful on my etiquette, both social and corporate etiquette, from how I pick up my phone calls to my delivery of services in different settings. The session also has helped me to realize and improve myself as a brand, and also a way of harnessing myself as a brand. I did a research study on Staphylococcus aureus, which is a bacteria of veterinary and public health importance, causing a vast array of pathogenic infections. And a major concern to most veterinary and public health practitioners is mastitis, which causes the swelling of mammary glands, tissue, and changes the consistency of milk. This leads to the immense use of over-the-counter antibiotics without prescriptions. Treating of animals without conducting an antimicrobial sensitivity testing has contributed to the evolving of resistance bacteria and also has led to increased misuse and overuse of antibiotics. The study objectives was to determine the proportion of Staphylococcus aureus isolates from samples submitted at the lab, to determine antimicrobial susceptibility patterns of Staphylococcus aureus isolated. And from the samples, I was able to isolate 53% of the Staphylococcus species, 24 being Staphylococcus aureus, and 29% being other species, which is Staphylococcus epidermis, if to be precise. This is the graph, and from the resistance pattern, after isolating the microbes, it was subjected to 8 common antibiotics, and you can see the level of each. There was resistance in each of the antibiotics, and it was and that shows that Staphylococcus aureus is a major superbug. And as you can see, 50% having a resistance pattern from Staphylococcus aureus and the impact of mastitis. There are so many challenges. It is a clinical health concern. The summary of activities done, I faced so many challenges, some few challenges like financial constraints in my research work, and also mostly in the publication of my study, which is a great challenge right now. The activity has improved my research work skills and has also boosted my confidence, creativity, academics, everything. It was so important in my life. Way forward. I intend to indulge more on research, which has become a new area of interest. Actually, I had not realized that, but through doing the interactions, meeting so many young people in this project through the breakout sessions, I was able to come up with an idea, and research has become like a new area of my interest. I am enjoying doing this, and I also intend to sensitize more on AMR in different platforms, school, my community back at home, and yeah, the support I would require is the support in publication of articles, materials, in outreach, and we'll be so grateful. Without guys, we are finally here. I am so happy that you're graduating today. And like someone mentioned from the group that the feeling we have today is making us feel like we can feast on chicken or have KFC and a big cold soda. We can buy a gown. I am so happy for this day. I really appreciate, and I appreciate the good work. Too bad we have the corona pandemic. We couldn't have met. Ajay, Saddam, Precious, you really meant a lot in my life and impacted me. And I am so happy. That's all. Thank you. And my special appreciation to React Africa for your support, your guidance. You were always there, Julian, Daniel. You really helped us. You really helped me, to be honest. And to the lab for allowing me to do my study there, and to my fellow AMR champions for making the program a success. I leave you with a quote that never doubt that a small group of thoughtful, committed people can change the world. Indeed, it is the only thing that ever has, by Margaret Mead. We might feel like a small group of people, but the impact we can do on AMR out there can greatly impact the whole continent. Thank you so much, and I'm so happy. Guys, we made it. Thank you.
Thank you so much, Lucy, for that, again, excellent presentation. And indeed, research is what gives us the evidence to inform policy, to try and advocate to the policymakers with this faceless problem of AMR. So it's good that the program actually helped you to be more inspired to do research. She had an excellent poster presentation at the MITAN event. She made also an excellent presentation. So continue with this work, and it's really encouraging to hear that you have learned a lot from your peers as well. I know the WhatsApp group and the Slack channel have really been active, and with students learning from each other across the different countries. So I'll just say, comment at this juncture that I'll just ask, especially our guests, to just bear with us since we are slightly behind schedule, but we do have 3 more student presentations before we get into the award ceremony. And I'll now hand over to my co-moderator at this juncture, who is Daniel Wairungi, and he's the co-founder of Students Against Superbugs Africa, and he's also a pharmacy student at the Jomo Kenyatta University here in Kenya. So Daniel will take us through the moderation of the remainder of the student presentations before we get into the awarding ceremony. Over to you, Daniel.
Thank you so much, Julian. I hope I'm audible. My network also has some challenges back here.
Loud and clear.
I hope I'm audible. Okay, thank you so much. Thank you. Unfortunately, I won't be able to share my video because of stabilization of my network. but I have my small passport photo there. So those ones whom we have not acquainted yet, that's my photo. As Julian has introduced me, I'm the co-founder and head of programs at Student Against Poverty Africa, and also a pharmacy student at Jomo Kenyatta University of Agriculture and Technology. So as was shared by Dr. Muffin, our work is mainly to empower young people and build their potential to be active advocates in the fight against AMR. And as Lucy has shared, I want just to share that again, because that's something that I really and really believe in, and that's what drives me every day, that never doubt a small group of thoughtful, committed people, and because they have the potential to change the world. For those of us who love history, I'm sure that you have seen that every great change in this world was started by a small group of people. And some of you know a Nobel Peace Laureate called Wangari Maathai. She was from Kenya and she won the Nobel Peace Prize for Environment. And she shared something about the story of a hummingbird. And I'll share that with us as we conclude the session. But for now, I would want to invite Polikalipo Kagina. Polikalipo Kagina is a student at Muhimbili University of Health and Allied Sciences in Tanzania, a radiography student. And Kagina is one of the students who took up the responsibility even before graduation and decided from the little that he had learned from the program, he will go forth and carry out a very creative community project. And with that, I'd love to invite Kagina. Welcome, and feel free to share a presentation. Please remember to keep time so that at least we are well within the schedule. Thank you so much. So Kagina, over to you. Kagina, can you hear us? Are you there?
Yes.
Okay. Are you able to share your screen, or we do
Yes,
it on
of
our
course.
end?
No, of course I will do. So a minute.
Okay.
Yes, thank you everybody. Good morning, good afternoon, good evening, depending on where you are. Yes, my name is Polikalipo Kagina. I'm currently doing my Bachelor in Science in Radiation and Medication at Muhimbili University of Health and Allied Science, just located in Tanzania. Thank you. I will take you through MLP experience with a focus on community engagement activities. Actually, without lagging into the time, then by starting the AMP learning, that is antimicrobial resistance readers program learning, and up now I can just say that Twitter is my warrior. In July, I discovered a very interesting opportunity. Sorry, can you hear me, please? Hello?
We can hear you, Kagina.
Okay. Now, up to now, I'm just saying that Twitter is my warrior is I discovered the very interesting opportunity of learning and increasing awareness in microbial resistance publishing in React Africa. Actually, in the student superbugs against superbugs, which also targeted a tertiary student as a target group. And I had no time to think it twice, but just to apply for. And sorry. And at that time, I had only one semester in a medical school, so antimicrobial resistance was not a common word I used to hear. But despite that, I had little understanding on the effect of not competing up prescribed drugs. But actually, there's no that understanding, detailed understanding of antimicrobial resistance. What is that? But as I like more to learn new things and be expert in many things. So I was intending to be a part of that program, and I was really excited after receiving an email being selected among few who will be allowed to attend the antimicrobial resistance readers at that time in 5 months from January up to December. Now we are graduating. So antimicrobial resistance readers program learnings, I can classify, it was very impactful, and I can classify into three mainly, but I cannot classify it I'm just saying that I cannot really classify it, but I'm just classified in 2-3 ways that it was student-centered facing, which increase the attention, focus, and motivate the practice high-level thinking skills. Students were able to organize some subgroups during the sessions and discuss and presenting what they have discussed. So this increased attention, focus to the topic, and motivate most students to practice high levels. Also, informative assignments which are given. Actual assignment increase understanding and discover valuable insights and improve idea about variety of related topics. So I was able to find some very interesting articles, writings from various writers and champions of antimicrobial resistance through assignments that we were given. Also, the antimicrobial resistance champions keynote speakers were that they leading the sessions, various sessions from the start, actually first month of the session. So that set our mind in a month that we are the one that is responsible to end this rate. As you can hear somebody, oh, Justin, I was doing this and now I'm at this level, and Justin, I do this and this to make sure that antimicrobial resistance is gone. And that, of course, sets us our mind in a manner that we can deal with this threat. Also, the summary of activity done, of course, I encourage more in doing the out community activities. And a few months after intensive training of from antimicrobial resistance program, I was motivated to pass information I have to others. So I just want to pass what I have or what I have learned from antimicrobial resistance program, from this program, to other outreach community or ordinary community, which they don't know even what they may know even they may don't know even what antimicrobial resistance is. So I decided to use a university holiday as an opportunity to do something in my community, of course, local community, that is Nyakahula, those words. And the situation, of course, is not really good as near all drivers of antimicrobial resistance was like our culture that we live in. So at that time, I had to think then who I will tell this or who I will educate this and what I will use, where I will locate my project, when I will use, and why to do so, and how to so. In answering all of these questions, I come up with the final decision that, oh, all of these questions can be handled within Tell Them to Tell Them project. The Tell Them project was a project that I did engaging in, meaning I did just to ensure there is appropriate awareness of antimicrobial resistance. And it has, at that time, it had I had three objectives, of course. One, to emphasize the rational use of antibiotics, but in a patient basis, like at the advantage of completing dose, medical dose prescribed, storing the effect of sharing some antibiotics or antimicrobials from hospital or pharmacy. Also, the next objective was to increase antimicrobial awareness, to create antimicrobial awareness volunteering team. And I was able to create this volunteering team in Nyakahula rural in Biharamulo there in Tanzania. So there's up to now there's 8 volunteering people who completing that course that was arranged. And the final was to create a contemplating society with intention to keep antibiotics working. Okay, but I had to think now how now I will submit the concept and how I will encourage people to listen what I have. So in answering those questions, then I had now to introduce a football competition team. But a football competition team just to circle the intention of society at Nyakahula society or Nyakahula community, then through the football competition, then I had now to create some series of sessions in there. That was maybe I had antimicrobial awareness session at each football match through the that was progressing up to 2 weeks. Then I had antimicrobial resistance volunteering. This team I created was also responsible to make a view or to make a presentation on each football sessions before football competition. Also, by using football competition, I extend the extent. I had to know the extent of antibiotics and antimicrobial resistance awareness in the community. So I just conducted a baseline survey before the project, and of course I did it again after the project to measure now how impactful this project was. And also I had to create fun experience to know football competition, just have fun in. So here the histogram here shows this graph shows some of the results of project. The first, I don't know if you can see others, maybe use this pointer. Yes, this one I pointed this show the antibiotics awareness just before the project. So the red one, the first red one, so we're able to explain what antibiotics is, but the second one, so the second one, we are not sure what antibiotics is, and the third one, the third one says no, that they don't know what antibiotics is. And the next one, the red one, is antimicrobial resistance awareness. So this one, we are not able to explain what antimicrobial resistance is. The following one, we are not sure, and I know we're not able to explain what AMR is. And the third one, of course, they're not sure. But after the project, then I conducted an online survey to know now what impact the project was. So the first history then shows that after the project, more than 70% of the participants were able to explain what antibiotics is, and the next we are not able, and the third one we are not sure. And in the case of antimicrobial resistance awareness, after the project, then the red one show that where more than 75% were able to explain what antimicrobial resistance is, and the second one we are not able, and the small one we are not sure what antimicrobial resistance is. So generally, the project implants some awareness of antimicrobial and antibiotics in Nyakahula rural world. Okay, the next slide. The next slide. Sorry. The next slide shows some photos of the project team. Here are some of football team. Here the competition show the picture with a political leader. Of course, I had a political leader who acted as guest speakers during the launching and the final match. Also, I had some flyers I used in Swahili language, so if somebody knows Swahili can appreciate it. Also, the project was included a student from Nyakahula Secondary School. So this student where I was teaching, sharing the awareness of antibiotics and antimicrobial resistance as well. Here are some pictures with some of volunteers that I created discussing how to learn the project. So moving now to challenges and learning. challenge number one, it's difficult to initiate antimicrobial resistance prevention team as number of people who are approaching, they were not able even to explain what antimicrobial resistance is. So I had a time now, I had to buy a time to explain to them what does this mean and why. But also there was low attendance of women compared to what is expected. Mostly it's because the approach that are using a football match, mostly women do not love football match. So women were few during the project. Also, the learnings now, I discovered that the position of trusted group in community or family in behavior practice, it is so large. So the trusted group in community or family, such as maybe educated people or some individuals that have education at risk, they have a great position in curbing antimicrobial resistance. These are the ones that give advice the use of antimicrobial resist and the use of antimicrobials. So if we are to cure the antimicrobial resistance, then we have to target facing this thing trusted group, such as maybe special students, like what we are doing now. Also, African women and antimicrobial resistance. Also, African women play a role part in family activities, mostly in caring of family, caring of, and are the ones that discover first what children needs or what makes children needs before the compared to man. So when targeting African women in curbing antimicrobial resistance, it can bring some impactful results compared to any community group. Also, volunteerism is needed much in curbing antimicrobial resistance. We need to volunteer ourselves to have a passion of doing a community active or of engaging with community activities and educating people. So we have to volunteer ourselves. But also what I learned is that community needs us. Community needs our effort. Community needs our knowledge. We don't need to just to have the knowledge in our minds, but we have to transform those knowledge into now our now as a graduate of antimicrobial resistance readers program. Firstly, I planned to have a university's symposium on antimicrobial resistance, which actually I later proposed on this also. It's my passion that I could have this at least in a series of months, to have a series of symposia discussing on antimicrobial resistance. This could create a trusted individual in community who will deliver correct information on the use of antibiotics, also the antimicrobial resistance. Also, this symposia, of course, we'll discuss a position of students, professionals, policymakers, and government in curbing antimicrobial resistance. Also, as a long-term plan, I planned just to empower women with infection control knowledge from the community, not too large. Maybe you can empower all the women in your country or in your district or whatever, but starting from where you are, just to empower those women with infection prevention control. With the way of preventing infection, it could be a better thing. Just from where you are, from the community, from your family, empower women with this one. Also, this to empower women will decrease antimicrobial use, also decrease the antimicrobial resistance rate. So this I plan just, it is a long-term plan, needs time and of course needs sacrifice to empower all men, but just in case to start, just you can start within your community, family, or surroundings. Up to there, then the target of all of these two interventions are to keep it is to keep antibiotics working or to keep antimicrobial working. So the final image shows that in order to move forward, then we need time and sacrifice. We have to buy our time. We have to sacrifice ourselves, and we have to do things in teamwork. We have to do things in teamwork, but also these are things are costly in man of time, in man. So funders also play a role part. May I congratulate you all for them celebrations. Have a wonderful day, and thank you, Julian. Thank you, organizers. Daniel, Alung, you two guys are very interesting. You not stop just to punch us at and the impactful and to give us impactful knowledge and convincing part. Thank you so much. Have a wonderful day.
Thank you. Thank you so much, Kagina, for that wonderful presentation. It's a clear manifestation of the we can draw some of the lessons learned into, deep into our local communities. Kagina comes from a place on the in the border of Rwanda and Tanzania. Yeah, and it was a good project as you've done. It has been done as per best practices. He had a baseline survey and an end-line survey. So due to time, I will invite our next presenter, Innocent Njazi, from the University of Zimbabwe in Zimbabwe. And Innocent will also present on his WOW experience, and in a special way in terms of, article publications and some of the great work that he did at Zimbabwe. So Innocent, welcome. Please, you have 10 minutes. Let's try to keep time so that we move over to the graduation ceremony. Over to you, Innocent.
Okay, thank you very much. Can you hear me?
Yeah, we can hear you,
Can
Innocent.
You hear me?
Yeah, we can hear you.
Good morning, good afternoon, good evening, depending on where you are. So my name is Innocent Jazi. I'm studying Bachelor of Science in Nursing Science at the University of Zimbabwe. So my presentation will be on what I did during the World Antimicrobial Awareness Week. That is on publication of an article in educating school children.
Thank you, Innocent. You can share your presentation in your slides in presentation mode, please.
Okay, let me share it. Can you see my screen?
Yeah, it's now visible. Yeah, it's visible. Can you try to?
Okay, so I came to know AMR Leaders Program through WhatsApp. It was a link which was sent in our WhatsApp group. Then I applied and I was selected to be one of the students. So I'm really grateful for the program. It was very, very beneficial to me, especially the first session where we are going through the materials on React website. They really broadened my understanding of antimicrobial resistance. So before I used to know in passing about AMR, but now I have my knowledge and my understanding has been expanded. So one thing I like about this program, it was an interprofessional program with students from across Africa. So it was interesting to learn together with the students from different programs. So every session was enjoyable with experts taking us through, experts from different organizations, and I learned a lot. And also it was good in a way that we were not only taught theory, but also planning and implementation of projects and system and design thinking. And that way it really helped me on how to be influential in the present world and how to advocate for change. So in other words, I was impacted with leadership skills in me. So that's where my learning in summary. So I'll go on to talk about what I did during the World Antimicrobial Awareness Week. So because of what I experienced during the program, I was motivated and I was inspired, and there was a drive in me to do something that to educate and raise awareness to the public. So I decided to write an article my article was titled Silent Pandemic, Antimicrobial Resistance. So in the article, I talked about what is AMR, the causes, the consequences, and how to reduce MR and lesson learned from COVID. That was my introduction on lesson learned from COVID. And I was comparing it with COVID, how we've been successful with COVID, so that we may try to implement those things. So it was in simple language, understandable to the public. And my article was published in Infinity Health News. It is available online. I will share with you the link so that you can read it. This is the link on the slide. So I will share also with the slide. So I also published it in Herald newspaper, which is the main leading paper in Zimbabwe. Since Infinity Health is only available online, so I decided to publish it also in Herald newspaper because about 40% of Zimbabwe adults read newspapers, especially during the weekend. So on the Saturday, 20 November 2021, my article was published in Herald newspaper. So with my article posted by Infinity Health News and Herald newspaper, I know that many health workers in the general public, they saw it. So this is the photo of the article in Infinity Health News, the silent pandemic, antimicrobial resistance. And this is also in Herald. This is the same article. They just changed the title so that the general public may understand it. It was published in Herald on the 20th of November, 2021. So my article reached many people due to the huge coverage of newspaper. I received the positive feedback from students, lecturers, doctors, and the general public. Many were saying that it was an eye-opening article. Many were enlightened. So it was something which was really informative. So I also educate school children. I went to Kingdom Knowledge Secondary School, high school in Zimbabwe, and my target population was Form 3 class in Zimbabwe. This would be the first level of ordinary level. So I went there and I taught them about antibiotics, antimicrobial resistance. So I made my PowerPoint presentation explaining to them the causes of resistance and how to curb it, how to combat it. So before I even started the presentation, I told them that you need to be attentive. And I also collected the baseline data, and I realized that very few were knowledgeable about what are antibiotics. And others, they thought that they can be used to treat the flu. So I collected my baseline data, and I also told them to be attentive so that after my presentation, I would ask questions and give some t-shirts. So I was wearing a t-shirt with an antibiotic logo. You will see it is in slides, with the photos. So yeah, I did very well. I presented to them, and after my presentation, I asked them questions, and their response were very impressive, and they showed that they understood, and it was just of joy to them and also to me that I raised awareness. So this is the photo of here I was standing in front and I was talking about antibiotic resistance. As you can see there, the slide and the students in the class. It was just a single class, and also here I was talking about the causes of antibiotic resistance. So here, if we're now outside, then these are with the students who answered correctly and whom I gave the t-shirt. So and the other two, they were holding charts which were written about antibiotics, and I left them at the school. So that is what I did during the World Antimicrobial Awareness Week, and I believe that many people are benefiting. They've learned a lot. The general public, and even also the health workers who saw my articles, and even also the school children. I told them to spread the message as they go their own. So way forward, I think to do whatever I did this year, I believe that it was just the small beginnings. I know that the best is yet to come, and I now have a drive, a strong desire to do something so as to address this silent pandemic. So in the future, I intend to do mass campaigns, raising awareness to the public, and that is increasing my target population. Since this year, I only raised awareness to just a single class. So I intend to increase my target population and raise awareness to the public, doing mass campaigns. And then also on writing articles, on my first article, my post was posted, and I now believe in myself that I can do something great. So I want to continue to write articles, increasing MR and knowledge, and also focusing on other things like the use of antibiotics in agriculture, which I believe very few people know about. And since I'm also a third year student studying nursing science at the University of Zimbabwe, I also want to initiate the AMR stewardship program in my clinical area. I realized that in Zimbabwe, at the referral hospital, the stewardship programs, they are there just in paper, but on ground, there's nothing. So I hope to bring a change in my clinical area. And this program has really changed me. I now want to focus on research specifically on antimicrobial resistant research. So I want to conduct AMR research, increasing the body of knowledge. As for now, I also have my research, which I have submitted to React Africa. So these things require support from different organizations. That is the same goals that I have. I look forward to partner with the React Africa and also other organizations, and it requires support from them. So as for the program, I really want to thank you for introducing this program. It was a special program to me. I profited a lot. And now I no longer view AMR as a minor program, but as one of the top 10 global health threats. So this was just a wonderful experience. I thank the organizers of this program, in particular, Dr. Muffin, Julian, and Daniel. I know we'll continue to work together. This is not the last day, but I hope we'll continue to engage together in trying to bring a solution on the table. I'm really grateful to be part of AMR Leaders. I appreciate the work it did. It really changed our lives. So I'm proud to be an AMR steward, AMR leaders, and true leaders are inspired by people and motivated by vision. They have a burning desire to change the world. So I thank you, AMR. I thank you all who are graduating today, and I thank you those who did great work imparting on us knowledge and leadership skills. Thank you very much for your time. It was a wonderful experience.
Thank you so much, Innocent, and congratulations on your graduation. Wonderful work. At least, publishing articles and not just stopping there, going forward and initiating programs in secondary schools, as you can see for yourself. And I'm sure that, as you've said, this is just the beginning. There's so much more that's coming. As even our first speaker presented, we'll even have an alumni group for all of us. So I can see Africa transforming, and I'm sure our continent is in very safe hands. I would love to introduce our next speaker, and our next speaker is right all the way from Nigeria, Oluwatosin Ajayi from the Federal University of Agriculture in Abeokuta, Nigeria. And as some of the students that we have in the program, we have most of them who are finalists. Even our first speaker is also a finalist. I'm sure we have other finalists in the house. Maybe you can upload in the chat box and say hi for those who are also graduating, not just in AMR, but also transitioning to professional practice. I'm sure we have quite a number I know personally in the group, and Ajay will present to us now that she went through AMLET program. What are some of the key practices that she will carry on to her professional practice? And what are some of the areas that we who are graduating can look at? Thank you so much, and welcome, Ajay. Congrats, and over to you. Hello, Ajay, can you hear us?
Good afternoon, everyone. Am I audible enough?
Yes, you are audible. You can go ahead.
All right. Okay, good afternoon, everyone. Guests, fellow graduates, and our hosts. I am Oluwatosin Tolilope Hajayi, a recent graduate of veterinary medicine from the Federal University of Agriculture, Abeokuta, Ogun State, Nigeria. I'll be presenting on my AMR leadership experience with a focus on transitioning from students to professional practice. I got to know about AMR leadership program through my mentor, who was and I was very, very excited to join the program because I was doing an undergraduate project on antimicrobial resistance. We did a 6-year retrospective study on antimicrobial prescription pattern at the veterinary teaching hospital of my institution. So when I got to know about the program, I was so excited to be a part of it. And as God would have it, I applied and I was selected to be among the participants. To me, because it gave me a broader understanding of antimicrobial resistance. It brought me to the realization of the burden and impact of antimicrobial resistance beyond what I was taught in class as a medical student. I got to know and I got to understand that antimicrobial resistance is already a problem. It is not something that will happen in the future. It is something that is already happening now. It is a silent tsunami that is not waiting to happen in the future. It is a pandemic that has claimed the lives of 1,000,001 people, to which more people still die by the day. And that made me to be so passionate about this problem of antimicrobial resistance. During the AMR leadership program, I also learned about practical applications on how to tackle antimicrobial resistance and also other soft skills like project management, work ethics, teamwork, and it also increased my network. Now I have friends from other African countries. I have friends from Uganda. I have colleagues from Kenya, different African countries, even some of them. And out of these people, some of them, I was even able to collaborate with some of them for my World Antimicrobial Awareness Week. And I look forward to future collaborations with a lot of these amazing AMR champion. So AMR leadership program has been of a very great impact to me personally. My experience engaging with other students was so productive. It was enlightening and fun. We had opportunities to interact together. I learned from them, they learned from me. We exchanged ideas. We had breakout sessions where I had to interact with some of the students, even facilitate events and all. So it was a very beautiful experience for me. My experience attending the session and assignment during the program was great. It was interactive. I had the opportunity of interacting with professionals from different disciplines, from different countries. It was challenging, it was educative, it was quite inspiring and ultimately impactful. AMR leadership program taught me and gave me practical experience on how to conceptualize, how to design, plan, and implement projects successfully. It taught me to collaborate and work with professionals from different backgrounds. The experience that I even had to already engage the lesson at some point in the course of the World Antimicrobial Awareness Week. It taught me to be a better presenter like I am doing right now. It taught me to be a better facilitator because I had to present at some point during the training. I had to facilitate at one point or the other, and it's taught me how to be a time manager, how to be a better time manager, because the training occurred at a very critical point in my life, where I was rounding up my program in medical school, and I had to balance the training with lectures, with clinics, with tests and exams. So I just had no other choice than to manage my time better. And that is one skill that will remain with me forever. AMR leadership program also, it's improved my leadership skill because I had to engage other people in the course of the World Antimicrobial Awareness Week. I led a team, and I had to work with other people and even put into practical use the experience and the lesson that was learned in the course of the training. During the World Antimicrobial Awareness Week, we engaged, myself and two other people in my team, somebody from Nigeria, another person from Uganda. We collaborated with two other groups, headed by Roger Senyonjo, the first presenter of today, and by Keya Wata, two students from Uganda, to carry out some of the activities. We did online campaign where over 100 youths across different countries in Africa were brought together via WhatsApp platform. They were orientated and inspired they themselves were brought to the consciousness of antimicrobial resistance and also prompted to do same in their environment. We created flyer design where each of them could put their picture and use their own content, their opinion about antimicrobial resistance, to also bring their communities to the consciousness of antimicrobial resistance. And we got very amazing responses from the participants. We also engaged in virtual lecture and panel discussion via Zoom, where my team collaborated with two other groups from Uganda, and where young professionals and students were taught on leveraging interprofessional stewardship approach to stop awareness and to spread awareness and stop antimicrobial resistance. We had a keynote speaker from Uganda, and then we had panelists from Nigeria and Uganda. The objective of the program was to bring people to the consciousness of antimicrobial resistance and also to promote One Health approach, antimicrobial stewardship, and AMR advocacy among students and young professionals. Over 100 students and young health professionals were educated and inspired to be actively involved in the fight against antimicrobial resistance. And the public was also brought to the awareness of antimicrobial resistance through our online campaign. These two people, Emmanuel Adamolekun, who is a medical laboratory scientist from Nigeria here, and Ruth Ketty, who is a student of cytotechnology from Uganda. They were my team members. We worked together. And then the other flyer, these flyers is just a few of the other participants that engaged in the online campaign. You know, this person is a public health officer from outside Nigeria to bring different professionals from different disciplines to engage in the campaign against antimicrobial resistance. This is the flyer of the virtual panel discussion that was held. Some of the challenges we had was fund. You know, we could only work within the limited resources that was made available for us. So, and that restricted the way we could engage the participant. Time was also a factor because there is a stipulated time for which the activities are to be carried out. One of the lessons learned through this activity was the future engagement of youth. I personally came to realize that youth are so passionate and enthusiastic about bringing about change in their communities. So if change will really be brought to be, then we really have to engage youths in future engagements. I also learned and practicalized my knowledge about project management and teamwork, and this also really improved my leadership skill. At the end of this program, I intend to, among other things, I intend to conduct a study to evaluate the knowledge, the perception and practices of young health professionals across Nigeria. I got to engage in this program, in this training in my final year, in my final days in medical school. And then I realized that the subject of antimicrobial resistance is not as, we were not really brought to the reality. It was just like one of those topics that was taught in school. The reality of the present state of the world as touching antimicrobial resistance is not being brought to students as it really is. You know, the program made me to really realize the burden and the impact of this pandemic. And so I'm so interested to find out if that is the way it is in other institutions. I want to find out among young health professionals, people who have just graduated within 2 years, medical doctors, nurses, pharmacists, medical lab scientists. I want to engage them. I want to find out their knowledge, their perception, and their practices as regards antimicrobial resistance. And after this study, I will also like to carry out a workshop to sensitize those people, to train them, to empower those professionals, to be good antimicrobial stewards, to be AMR advocates and change agents in their communities, because really it begins with us. I will require funding for this project to be successful. I will also require a recommendation letter for ethical approval for the study to be carried out, and also resource persons to successfully carry out this project. This is what I've been saying since the beginning of this program, and that I will continue to say, that antimicrobial resistance is not a problem that can be solved by some people. It is a problem for everybody, and all ends must be on deck for this fight to be won. Thank you for listening. Congratulations to all the graduates. Thank you.
Thank you so much, Ajay, as you prepare to drive a wave across Nigeria. I'm really hopeful that that project will really bring out more young leaders, especially now, the professionals now, people who just graduated within 2 years, and I really look forward engaging with you in the project. At this juncture, now we are done with the presentations, and we enter to the preparations for the day, the graduation ceremony. I'm sure you're all excited so much. Some of us even went forward to hiring graduation gowns, so many discussions, a lot of excitement in the group. Yeah, and I'll hand over to Julian to steer us through, and congrats everyone. Thank you.
Thank you so much, Daniel, and thanks to the great presenters in this session. All the 5 students did so well. I'm sure you'll agree with me, even with the comments coming through the chat. And it was very tough to decide which students to present, because all of these AMR lab champions were really doing great work. So what we have done is just compile a very short video, 5 minutes, which will be more like a short break as we transition into the awarding ceremony. This video just showcases, it's mostly the flyers of the work that the champions did during the World Antimicrobial Awareness Week 2021, and some of the projects that were highlighted in these presentations that were done. So we'll share that video as we move on to the final part of the program. And as I said in the beginning, I'll just ask for the guest speakers to just bear with us, because we are slightly behind time. The Antimicrobial Resistance Leadership Program for Tertiary Students in Africa is a program that REACT Africa is piloting in collaboration with Students Against Superbugs Africa. The goal of the program is to have empowered student leaders in Africa who are problem solvers and solution providers for the antimicrobial resistance global health threat. This short video is a collection of flyers, photos, IEC materials that showcase the work that the students have been engaged in their respective countries following the training and sensitization sessions that we had in this program. And this also includes articles, football matches they did, social media posts and radio shows, and a lot of other key activities that they did during the World Antimicrobial Awareness Week 2021. So thank you so much. I think you managed to see some of the great work that the students have really been doing. So apart from the 5 that made presentations, I'm sure you saw some other faces that were there. And indeed, these are really AMR champions, very committed, very motivated to make a difference and actually do work in their respective countries. So now we are transitioning to the part that we have been waiting for, the awarding ceremony. So how this will work is that we will have a guest speaker who will just give us very few remarks. And then from there, we then just call out the names of the graduates that are here with us as your graduates in quotes. And when that happens to the students, if you'd want to switch on your video as your name is being called out, please feel free to do that. If you'd also want to just write something in the chat, please also feel free to do that. We will not allow you to mute in the interest of time, since there are quite a number of students that we have to go through in the list. So I will share my screen as I invite our first guest speaker for the session. And our first guest speaker is actually Dr. Yewande. And Dr. Yewande Alimi is an antimicrobial resistance and One Health program coordinator at the Africa Centers for Disease Control and Prevention, Africa CDC. She joined us even during the launch event on the 16th of July, the one Dr. Murphy mentioned at the beginning of our session today. So she was one of the speakers there. She actually motivated, inspired the students as they started this program. So thank you so much for making time to join us again as the students now are coming to the end of the year and celebrating the different work they have done. So over to you, Dr. Yewande. I'll just give you just 5 minutes to just give very brief remarks. Thank you.
Thank you very much, Julian, and good afternoon and congratulations to all of the students who are graduating today. I always like to say, once you're an inaugural cohort, you are what we call the trailblazers. You are the pioneers of this initiative, and you should be incredibly proud of yourselves. Thank you very much to React Africa for inviting me to join this. I think I was lucky enough to join the opening of this this training series where I was able to sort of give you good words around the fact that you are the champions, you're the future of AMR in Africa. You're the ones to champion the behavior change that we want to see. You're the ones who we are really hoping would keep this continent safe. So I think, first of all, I'd just really like to applaud your effort, your commitment to staying on this course and to showing the good commitment. I looked on Twitter today and I've seen many of you post your pictures. It is something to be proud of. I think the spotlight is now on the continent. This is unique because we are doing this because we recognize the potential the African youth brings to the table. So I think I just really want to applaud your efforts. I want to let you know that Africa CDC remains committed to working with the younger Africans, the African youth, because we know that the future is right there in your hands. We have started in the trailblazing, but in terms of innovation, using technology, using better means of advocacy like social media, I think we heavily rely on you because these are the things that you understand. These are the things that you are quite savvy with. So we are hoping to see more innovations, more ways to coin and adapt our AMR messaging that younger people can understand. The vision that we see is that a 5-year-old will understand what antimicrobial resistance means. A 5-year-old will understand the need for hand washing and hand hygiene, respiratory etiquette around preventing infections. A younger child at 5 would understand that it's not okay that we try to buy over-the-counter antibiotics without prescriptions. So who else can connect us to that younger generation? Who else, apart from you, apart from your generation, apart from your cohort? So it's a heavy responsibility we are putting on you, but we strongly believe that you have the skill set. Thankfully for the amazing training that React Africa and SAS Africa have been able to put together. We are definitely looking forward to exciting activities from you. Africa CDC and Africa Union Task Force on AMR remains committed to supporting the work that you're doing. So I would really like to congratulate you, and I definitely look forward to working with you. And most importantly, I really like to applaud the efforts of React Africa and SAS Africa for putting this amazing initiative together. This is something that we haven't been able to harness, and that's the capacity building for our younger generation, for students. So this is huge, and congratulations to you, Daniel and Julian. So thank you very much for having me, and I really like to congratulate all of the awardees today. Over to you, Julian.
Thank you so much, Dr. Wande. And indeed, the students have been challenged to share in the vision that she has, the vision of having even a 5-year-old know what AMR is. And indeed, the students are the bridge to make sure that this happens. So now I'll call upon our very first student who's going to be awarded here. And this is Arishaba Adela. Arishaba Adela is from Barara University of Science and Technology in Uganda. Congratulations. I'll be quite fast in the interest of time. So we applaud Arishaba Adela. The next student is Aberij Adewale Lanre. I hope I pronounced your first name correctly, and congratulations. He's from Bayero University, Kano in Nigeria. So this, to learn more about the students, we actually have a link that we'll share that has got more detailed profiles of what they are studying at their institutions, and also what they have learned from the program, what their plans are, so that you get to learn more about them. So this is just a summary. Congratulations, Lan. Ajay Oluwastin, you managed to do a very excellent presentation this morning. She was also she shared her feedback during one of the sessions that we had after the online training session during the program. So congratulations. She's from the Federal University of Agriculture in Nigeria. Akampu Musa Davis from Barara University of Science and Technology in Uganda. Congratulations. Akaka Alex, Makerere University, Uganda. Congratulations. Congratulations to Amwine Ernest from Barara University of Science and Technology here in East Africa, Uganda. Congratulations. Seboa na Yonga Anastasia from Makerere University College of Health Sciences in Uganda. Congratulations, Anastasia, and thank you. She was actually supporting us with rapporteuring some of the sessions during the program, and congratulations. Congratulations to Arnold Lubega from the School of Public Health in Makerere University, Uganda. I hope we are actually chatting as we go on, and you can also put your video on if you would want to. Caroline Birungi from Makerere University, Kampala in Uganda. Congratulations. Congratulations to Caroline, again, Nyamo from Makerere University as well, the School of Public Health. Mutesi Charity, congratulations. She's also from Makerere University in Uganda. Actually, I think as you saw in Dr. Meffin's presentation, Uganda had actually the highest number of students that applied for this program. So Congratulations. And congratulations to Charles Lucas from Muhimbili University of Health and Allied Science, Tanzania. Congratulations. Rogers Duncan from Makerere University, Uganda. Congratulations. Atieno Gillian, congratulations from Moi University in Kenya. She was part of the actors during the World Antimicrobial Awareness Week here in Kenya, where they did a skit in front of the other guests that attended the symposium during the launch of the World Antimicrobial Week in Kenya. Congratulations. Adamu Ibrahim from Federal University in Nigeria. Congratulations, Ibrahim. Now we move down south to Zambia, and congratulations to Selachi Ignatius Kaembe from the Copperbelt University in Zambia. Congratulations. And at this juncture, I will hand over to my co-moderator, Daniel, who introduced our next guest speaker to just give a few remarks before we move on to the next group of students. Over to you, Daniel.
Thank you so much, Julian. Congratulations, everyone. Our first group, I'm sure that you really deserved it. It has been a very, very busy journey. I'm sure that we can relate to it, and congrats all. So we'll proceed, and I will invite our next speaker, esteemed guest, Dr. Ismail Kane. So Dr. Kane is one of the One Health and AMR expert, public-private engagement at FAO Regional Office, that's Food and Agriculture Organization based in Accra, Ghana, where he's in charge of the AMR multi-stakeholder partnership platform in collaboration with the Tripartite Plus and UNEP, that is FAO, OIE, WHO, and UNEP, aiming in broad regional representation and engagement in Africa and building partnerships with stakeholders along the One Health spectrum, contributing to regional and global governance and catalyzing action to address AMR. So Dr. Kane is also a veterinary epidemiologist with over 20 years of experience in veterinary public health in West and East Africa. And before joining FAO, he served at the OIE, the World Organization for Animal Health, as a technical. He also served as a technical coordinator at Regional Disease Surveillance System Enhancement, that's funded by World Bank. And between 2017 and 2020, he led two USAID funded programs, the Global Health Security Agenda Program in Mali and the Emerging Pandemic Program in Senegal. So welcome so much, Dr. Ismail Kane, and we are really happy and glad to have you here. And our students, as you can see, we have very senior professionals in the house are flagging us off. Thank you so much. Over to you, Dr. Ismail.
Thank you very much, Daniel, for your introduction and giving me the floor. Thank also very much to React Africa and the South Center hosting the second virtual annual conference, the progress achieved on Global Action Plan on Antimicrobial Resistance and Pandemic Preparedness in the Africa region. This side even React Africa and South Central Virtual Conference 2021 dedicated to celebrate the AMR Contest Leadership Program for Students in Africa. And of your celebration is a great initiative of React Africa to expand and extend Africa-wide for the next generation of young African pioneers in AMR. So I'm pleased to be invited here and to be with you today, thanks to the magic of internet, to be part of this virtual awarding ceremony on behalf of FAO, the Food and Agriculture Organization of the United Nations. FAO, as you know, is supporting this initiative with the tripartite, and FAO is also really committed in supporting innovation and resilience in food and agriculture sector across the AMR domain. So AMR Sector Platform, as you know, is to creating a movement for change through engaging multiple actors and voice. By working together, I'm sure we can through the spirit of antimicrobial resistance. And in doing that, FAO also released 60 publication videos, organized seminars of the FAO AMR website, which address AMR in the food and agriculture sector, both online and offline. FAO also has developed a number of behavior change initiative, communication product, and guideline at regional and national level during the last FAO Action Plan 2016 and 2010. So we FAO acknowledge the long-standing commitment of REACT Africa in providing support to African countries. We know that REACT Africa have as reflected in several initiatives. So I just want to go over. But last month, I attended the World Antimicrobial Awareness Week 2021 for Africa pre-event, hosted by the African Union and the Tripartite, increasing civil society organization and major participation in the regional agenda to address AMR, including discussion for an effective world. I had the honor to present the draft African Regional Strategy on Antimicrobial Resistant Communication and Advocacy. And there was a chapter dedicated to student bodies, who they are, what do they do in the AMR scam, and what is the role in AMR litigation. So to show that this is very important. I just want to share with you, the dear student and awardee, a quote from Dr. Margaret Chan, the former Director of General of the WHO, saying that antimicrobial resistance is a crisis that must be managed with the utmost urgency. As the world enters the ambitious new area of sustainable development, we cannot allow hard-won gain for health to be eroded by the failure of our mainstream medicine. We know that antimicrobial resistance is a natural process whereby microbes evolve to be able to resist the action of drugs, making them ineffective. It is a natural occurring process, but also it is a threat of two main reasons. First, the use of antimicrobial resistance has increased so much in the last few decades that microbes are exposed to a much larger number of a greater concentration of antimicrobial, increasing their chance of developing resistance. Second, worryingly, in some category of antimicrobials, particularly antibiotics, there are very limited number of new drugs under development to replace those rendered ineffective by rising drug resistance. Dear awardees and students, the true magnitude of antimicrobial resistance in humans is not fully known. That said, this afternoon, we are here to celebrate you and your achievement in this contest leadership program for students in Africa. You young people have made us extremely proud. A huge congratulations to all of you awardees. You have definitely set a very admiring benchmark for the student in Africa to imitate. We hope that you will continue to achieve triumphs in your respective future career and especially in advancing the everlasting fight in AMR prevention or in other spare too. Student, the future, our hope. You are the key stakeholder in addressing AMR. Really, it is a catchy slogan. It is our shared responsibility to support you in building the next generation of AMR champions. Dear awardee, worldwide, we are facing shortage of professionals who are well trained in the AMR domain to improving awareness and understanding of antimicrobial resistance and to better improve awareness raising in communities. I'm pleased to share with you some AMR useful resources or opportunities that target youth from our organization, FAO, and elsewhere. You know that the FAO is implementing the opportunity for youth in Africa, accelerating job creation in agriculture and agribusiness program. So I think that you can consult this in FAO website. There is also another opportunity. I strongly recommend you, dear awardee and student, to consult the FAO Young Professional Program. The Young Professional Program is a recruitment initiative targeted at talented, qualified young. Please visit the list of opportunities currently available in the organization. Please also explore the Associate Professional Officers Program for young people selected and sponsored by their own government to work for FAO and the trust fund arrangement between FAO and resource partner, mostly from upper, middle, and high income countries. Explore also the farmer field school approach, which is very innovative. And also the social science research on AMR is a new, while rapidly growing research area that require continued and intense global effort from an interdisciplinary and One Health approach. So AMR Social Science launched to provide solutions to antimicrobial resistance, understanding how different social, political, and economic contexts shape local antimicrobial practice and the perpetuation of resistance across culture and culture. Last but not least, I suggest getting into the free accessible Fleming Fund course, tackling antimicrobial resistance, comprising a set of online modules. The aim of this course is to help you to identify, develop, and apply skills and knowledge relevant to your role in order to change and improve your working practice and the practice of people you work with. At least I'm going to recite a few lines. Succeeding in life is as simple as being a good student. All of you have to do is pay attention, work hard, and give it a best shot. And set on the key takeaway message from the term on AMR experience with a focus on transitioning from student to professional practice. Dear awardee, I wish to all of you a successful transitioning pathway. Thank you very much.
Thank you so much, Dr. Ismaila, for the wise words and for sharing those good opportunities with us. We'll be sure to share them with the students too. Please also check, we'll share them with you students. Thank you so much, Dr. Ismaila, for taking your time to attend the session and also to share with us your wise words. We do really appreciate and we do not take it for granted. Thank you so much. So Julian, after we have been flagged off with the wise words from Dr. Ismaila, we can then now proceed over to our next batch of students who are graduating today. So you can move to the next slide, please. Thank you so much. And we have Nakasita Immaculate from Mbarara University of Science and Technology in Uganda. Wow, Mbarara. Thank you so much, Nakasita, and congratulations on your graduation. Thank you so much. And we have Inechi Obianuju from University of Jos, all the way from Nigeria. Congratulations on your graduation. Yeah, so please, if you're in the session, just tell us in the chat box so that at least we know that you're also there with us. And over now to our presenter for the day two, Innocent Njazi from University of Zimbabwe. Congrats, Innocent, and I'm sure that Zimbabwe is in safe hands with you. Congrats on your graduation. We go over to our next drug researcher, big drug researcher in the globe, Jimmy Kipetwan Kawitwe from Kenya, right here, my fellow university mate. Congrats, Jimmy, on your graduation and all the best. I'm sure that you really trailblaze when you come to drug research and discovery. Congrats. And over to Joseph Atwaru from Mbarara 2, University of Sciences and Technology in Uganda. Atwaru is one person who never misses a session, even one, always submits everything on time. So congrats, Atwaru, and keep up the commitment. I'm sure that you really impact a lot in Uganda and Africa. Congrats. Now can move to the next, Julian. I hope I'm still audible. Maybe Julian, you can confirm.
Yes, we can hear you, Daniel. Please go ahead.
Okay, thank you so much. And over to South in Zambia, Josephat Kole. And Josephat led a team of, I was even surprised of how they engaged together. A group of different students from different universities in Zambia. They came together and did so great wow activities. Congrats, Josephat, and keep up the leadership role. So we can move to next, Julian. And over now, all the way to Busitema, East Uganda, Juliet Carano, congrats on your graduation and keep up the good work with Rogers there. Congrats. And over to Mbarara, Tevin, congrats too on your great work. Keep up the commitment, Tevin, and keep up championing. I see you do a lot of, community outreaches, a lot of medical camps. Keep up the spirit, and I'm sure that you'll be able to reach out to many more people. Congrats on your graduation, Tevin. And over to Lilian Patricia from Makerere, Uganda too. Congrats, Lilian, and keep up the great work. Lucy Gatitu, our presenter too for the day. Lucy, we will now rely on you in research. We hope that we'll get to do more research, and also not just in Kenya, but across Africa too. And congrats on graduation, and keep up the great work. Paddy Derrick from Barara too. Keep up the great work at Barara. I love the teamwork and continue engaging collaboratively. I'm sure you'll really achieve a lot there in Uganda. Congrats too, and all the best. Then we have Mandela from University of Zimbabwe. I was just reading your article in the morning, Mandela, on the role of students, the role that students can play in the fight against AMR. Very, very insightful and very engaging. Thank you so much, Mandela. Keep up the great work at Zimbabwe. And I'm sure with Innocent, with Ngoni there, you really achieve a lot together. Thank you so much, and congrats on your graduation. Then we have Smart from Barara too. Barara seems to be representing well in the house. Shamim, yeah, congrats on your. We can go to the next, Julian. And then we have Mother Nabatanda from Makerere University. Mother, we have also engaged before. I remember we have engaged in gamification, and so keep up the great work, and I'm sure that we'll continue the great engagement. Congrats. And then we have Martin Sagide Rogose from Kabete National Polytechnic. That was then, but he's now a medical laboratory technician, already graduated. Martin, it's been a long journey. Congrats on your graduation. Keep up the great commitment, keep on networking, and keep pushing. And wow, I love your commitment, Martin. Congrats on your graduation, and keep up the great work. Then we have Maureen from Barara. Maureen, keep up the great engagement too in the club, the math club and all the other engagements there in Barara, and link up too with other collaborations from other areas in Africa, and I'm sure that we'll achieve together. Congrats, Maureen, and all the best. So I'll then hand over to Julian. Thank you so much for our batch 2. Thank you so much. Continue the great work, and I'm sure it's just the beginning. Over to you, Julian.
Thank you so much, Daniel, and congratulations to all the students in that group. Without wasting time, I'll move on to our next guest presenter, guest speaker, who is Dr. Jane Loero. Dr. Jane Loero is AMR Technical Officer at the World Organization for Animal Health, OIE, Sub-Regional Representation for Eastern Africa, office in Nairobi. She covers AMR, One Health, and food safety. Dr. Loero provides direct support to countries to compile antimicrobial consumption data for OIE global database on antimicrobial agents intended for use in animals, and contributes to the focal point seminar for veterinary products and promoting antimicrobial stewardship. Dr. Loero also coordinates the AMR Multi-Partner Trust Fund in Kenya. That project, she's the coordinator, and co-implements similar projects with FAO and WHO in Ethiopia and Sudan. She holds a Master of Science in Veterinary Public Health from the University of Nairobi, and has undertaken further training in One Health, governance, food safety, residue testing, and research on AMR. Thank you so much, Dr. Jane, for making time and for all the support. She was here again in the first day of our of this conference that we have a side event for. So over to you, Dr. Jane, for a few remarks.
Thank you, Julian, and congratulations to all graduates for today. At this juncture, we all know that we can agree we need you to be part of the AMR network, the voices on AMR messaging. We need you to play your role as the vital role that you are being bequeathed. We know you are part of the youth. You have a vital role in framing AMR for your generation because you are vibrant. You come up with appropriate messaging that is age relevant, that is language relevant, and therefore this will help the AMR messaging capture your peers' attention. You are dynamic, and therefore you will depend on that dynamism to use the effective platforms that you have been engaging in. You are techno-savvy, and by so doing, passing the messages in the relevant platforms, you'll be empowering all your colleagues, the young and others, in taking action to mitigate against antimicrobial resistance. I have heard some of you are still in college, some have graduated. This means that you are all going to be at the front line in the battle against antimicrobial resistance. And as we all agree, it starts with you. In your classrooms and during the field trainings or your areas of work. In contrast to your other predecessors or other students who have gone before you, you are going to be graduating at a time when there's an increase in the rate of antimicrobial resistance. And this has been compounded in our time by the COVID pandemic. But that is not to say that we have to lose hope. We know that we want to use your voices to preserve the efficacy of the antimicrobials that are still efficacious as of now. How are you going to do this? You have learned, or you are going to learn, how to choose and prescribe antimicrobials. You are better placed in knowing why it is important to follow the guidelines on antimicrobial use. You know why it is not prudent to use antimicrobials as a blanket treatment for everything that ails us or ails the animals. You will learn why you need to consider the first line of treatment and not use any antimicrobials for any treatment when it is required. We also have to learn about the importance of knowing the different categorization, what is critical for humans, and how that should be handled when it comes to treatment of animal diseases. Above all, apart from using antimicrobials, you are our agents of change. We depend on you to also educate our farmers and the other members of the public why we have other ways of taking care of our animals that would reduce the incidences of infection in the flocks in our farmers' keep, such that the farmers know the importance of undertaking farm biosecurity measures, hygiene, feeding their animals well, vaccinating their animals against the diseases that have vaccines, and also that you will be able to challenge the choices of treatments when they are given, to make sure that it is the correct treatment. Today, you have been initiated into the AMR work. Let your light shine bright as your zeal to see a drug-resistant free world motivate your actions. We are counting on you to play your role in fighting against antimicrobial resistance. Once again, I congratulate you all. Thank you.
Thank you so much, Dr. Jane, and apologies for the technical hitch that happened towards the end of your remarks. And really, thank you for reminding us about the importance of the biosecurity measures in the animal health perspective. Indeed, as the presenters were talking about the importance of making sure that we don't only focus on human health, but look at it from a One Health perspective. And indeed, you have been challenged that you are graduating at a time when indeed this problem has even become more complex, even further compounded by COVID-19. So thank you so much, Dr. Jane, for those excellent remarks. So we move on to our next student, who is Mbusa Sibiri Hauma from Makerere University, Uganda. Congratulations, Mbusa. And we go down south to the Copperbelt University, where we have Misebenzi Nalukui. She has actually reached out when we just started the program. She's willing to see how she can actually help, how she can help in trying to make sure that the ideas she has in Zambia come up to be a reality. Congratulations, Nalukui. Congratulations to Moses Walijo from Uganda, Makerere University. He's from the School of Public Health. Congratulations and continue the great work that you're doing in Uganda. The next student is all the way from Nigeria, and it's Mustafa Abdurazaz. He's from Ladoke Akintola University of Technology in Ogomose. Nigerian pronunciation always difficult. Congratulations to you and well done for the great work that you're doing. And we move over to our student here, originally from Tanzania, but in the University of Edinburgh in UK. And her name is Judith Abele Mwamelo. Well done, Judith. Congratulations to Manda Genatio from Mbarara University of Science and Technology, Uganda. As mentioned before, Uganda is really where we have most of the students, and congratulations. And with the synergy that's there, it's encouraging to see, as you saw, that the students from Uganda are even partnering with students from Nigeria, coming up with joint efforts. So continue that and congratulations. Ashanye Nathaniel from Nigeria, Obafemi Luoyo University, Ife from Nigeria. I hope I got that right. Congratulations and continue with the great work that you're doing in Nigeria. We have Ngoni Muzondo from the Harare Institute of Technology in Zimbabwe. Congratulations, Ngoni. He actually managed to put together a very good webinar series that is championing there with the Pharmacists Association in Zimbabwe. So continue with that great work, Ngoni, and congratulations. Amuza from Uganda, Amuza Nashabaruhanga from the School of Public Health, Makerere University, Kampala in Uganda. Congratulations. The next student is from Uganda as well, Mbarara University of Science and Technology. I think you saw in the short video that we shared that they've come up with the master group that they're actually using to make sure they raise awareness amongst other students. So congratulations, Gambo Octave from Uganda. We move over to Jacob Michael Otieno from Makerere University, Uganda. Congratulations and continue the great work in Uganda. Pamela Karimi. Congratulations, Pamela. She's from Jaramogi Odinga University of Science and Technology here in Kenya. Congratulations and continue with the great work you're doing. We move over to, today I'll say his first name. I always call him Kangina because this one just is a tongue twister for me. Congratulations, Polika Lipo, I got it right, Kangina, from Muhimbili University of Health and Allied Science, Tanzania. He shared his presentation and the innovative project he was doing for Tell Them. Congratulations for the great work and continue doing so in Tanzania. Prosi Nakito from Makerere, sorry, there's a typo there, University School of Public Health in Uganda. Congratulations for the great work. We move over to Ruth Kisuza, Makerere University, Uganda. Congratulations, Ruth, for the great work. Saddam Kajubi from Makerere again University in Kampala, Uganda. Congratulations, AMR champion, and continue championing for AMR so that we preserve these molecules, as our speakers have said. So now at this juncture, I'll hand over the floor to Daniel, my co-moderator, to introduce our next guest speaker. Over to you, Daniel.
Hello, I hope you can hear me, Julian.
Yes, loud and clear. Thank you.
Okay, thank you. Sorry, my network doesn't want us to congratulate our wonderful students today. So thank you so much, Julian. I'll move over to our next guest, Dr. Philip Matthew, all the way from India. So Dr. Philip Matthew is a consultant at React Africa, and he's a medical doctor specialized in community medicine and public health, working as an assistant professor at medical school in the state of Kerala, India. He has also been involved in the implementation of a number of community-based healthcare programs and has assisted the state government in several healthcare initiatives. He also serves as a consulting clinical epidemiologist and is serving on the board of India Clinical Epidemiology Network. So Dr. Philip Matthew has been with React since 2017, and he has been involved in liaising with multiple interest groups like farmers, government personnel, civil society organizations, media professionals. He has also conducted multiple actions to sensitize and engage these groups on the issue of antibiotic use and AMR. He has also been involved in the mission to popularize unbranded generic medicines that are manufactured by not-for-profit manufacturers in India. And I'm sure you've all heard of, some of us have heard of the ASPIC clubs in India, doing great work there too. And I'm sure some of you also remember our design thinking guest, Diani Prake. I'm sure they've also engaged with Dr. Philip Matthew at one point. So welcome, Dr. Matthew, and thank you for being here.
So thank you, Daniel, for that introduction, and thank you, React Africa, for this opportunity. And first of all, congratulations to all the new graduates. I think this particular program is extremely important, the leadership program, which is being run by React Africa and Students Against Superbugs Africa, primarily because there is a language problem with AMR. We have, as an AMR community, we have failed to convince policymakers about the importance of investing time and energy and resources into AMR. And that is a problem why our national action plans are not really taking off. I think all of you must be aware about the perceptual issues with AMR. Most of the people see AMR as a very distant problem with drivers primarily in the healthcare sector. And the other two dimensions of AMR, for example, the agriculture or the veterinary, or rather the environment dimension of AMR is very conveniently forgotten. So I think only students can actually serve as a link between the broad scientific community and the general public. And that is the only way in which we can actually convince the general public and the policy community about the importance of actually investing in AMR. So that is one of the reasons why this kind of a leadership program is extremely important. Second, if you look at the startup ecosystem that we see across the world, be it people working on novel diagnostics, newer antimicrobial agents, all these companies are actually led by young people, and most of these companies are led by people who are below 25 years of age. If you look at all the biotechnology clusters which are there in India or in parts of Southeast Asia, all of them are led by young people. So I'm sure that the next round of biotech innovators or whoever is thinking of innovation in this particular space is going to come from Africa. So the next round of leaders are definitely going to come from Africa, and there is enough and more funding out there to actually sustain, a certain level of interest and entrepreneurship in this space. Third, we all speak about One Health, but then if you look on the ground, One Health is just a buzzword and it's actually not operationalized. People don't work together. Each sector function in their own silos. So sectors are not collaborating. We speak very nice words about. We put in very nice words like trans-sectoral collaboration and intersectoral engagement and all that. But the fact of the matter is, people don't work together. But in a leadership program like this, I think those barriers are broken down. You have people from pharmacy background, you have people from veterinary background, you have students from medical background. All of you are working together to create something new. So that breakdown of barriers has to happen at the leadership level, and the next generation of leaders being produced through this program actually get exposed to working together with multiple sectors, and that is a great thing indeed. We run a very similar program or rather, we run an initiative called Aspic Clubs in India, which is basically a university network. We have 16 colleges and universities under the Aspic Club network as of now. We organize multiple competitions to provide small scale research funding. We have this annual photography competition. We have several seminar series running. So what we're trying to say is, we have React Asia Pacific is running a very similar program in South Asia. React Africa is running something in Africa. React Latin America is doing some bit of student engagement in the Latin American context. So I think React Group sees this as a priority because we need to build the next generation leadership in global health, and that's the only way forward for AMR to get highlighted, and also the systemic deficiencies that we see all across the world to get highlighted. Like if you look at the problems faced by Africa, South Asia, or Latin America, these are all very, very similar. Our healthcare systems are broken. We have chronic underinvestment in agriculture. We have our environment management systems are truly deficient. So these are things that we need to solve. We need to solve together. And one country or one set of students or one set of people, one set of leaders cannot do it alone. It's a very collaborative effort, and there has to be a southern dialogue. Students from the south talking to other students in the south and trying to come out with solutions which actually work for us, in our context. So I think these kind of leadership programs should be expanded on a more global scale. I'm sure that at some point of time, our Aspic clubs and the students from this leadership program should start talking together or start talking to each other. So all of these things will help students to actually collaborate and learn the benefits of collaboration and possibly come out as better global health advocates. So thank you so much for giving this opportunity. I wish all the new graduates the best in their future. Thank you.
Thank you so much, Dr. Matthew, for always championing, at least the coordination of different groups. I remember earlier in the year, this is something great that you championed. Thank you too for the wise words, and I'm sure that as you've learned, and also for our alumni group, I'm sure that in the coming year, we'll be able to have some exchange sessions, such like where we have different engagements with students from South America, others from South Asia, and yes, that at least you're able to learn from each other and champion together. Julian, I think with the wise words from Dr. Matthew, we can then proceed with our batch 4 of our graduates today. Yeah, some were just telling me, it's just because of the COVID-19 pandemic, but I'm sure next time, sometime when all this subsides, at least we can have a physical one and even have the gowns that some of you are planning on having, and also some of these sumptuous lunches so that we celebrate together. So we can move over to our next maybe graduate, Julian. And we have Nabida Shamim. Wow. So Nabida is a hospital at Barara, and she's really doing a lot. She has been involved in so much Millennium Fellowship, and she's also yeah. So congrats, thank you. Congrats on your graduation. We can go to our next graduate, Julian. And then we have Senyonjo Rogers, our horsepower in East Uganda and Africa. So congrats, Rogers, and keep on the great work. And together with Shamim, I'm sure both of you are graduating. I wish you the very best as you enter the next phase. Congrats. Over to Lawrence Teremwa, also from Barara. Thank you, Lawrence, for being committed, always attending the sessions and always for submitting everything on time. Thank you so much and congrats on your graduation. We can go to our next graduate. And then we have Karen and Nandago Dekla. Karen, thank you so much. I have seen that you love so much collaborating, doing things together, and keep up the great work, Karen, and all the best to with the Makerere team. Thank you and congrats on your graduation. And then we have Isaac Okot from Makerere University. Isaac, keep up the great work at Makerere and all the best. Congrats on your graduation. And then we have Michelle Mayuba. These ones I'll share a quick story about them at the end. So Michelle, in the program we have some students who are really supporters behind the scenes, and Michelle is one of them. Michelle has been our key rapporteur. I remember our evening sessions after classes late into the night. Impactful activities. Thank you so much, Michelle, and congrats. All the best. So Michelle, congrats on your graduation. I can see maybe it seems that we have a technical hitch. I'm sure for those of us maybe who've been knocked out of the session, we're addressing it at the moment, and I'm sure that Julian will update us on the same within some time. So thank you so much, and we can maybe proceed to our next graduate, and then we have Gadai. Gadai, Julian can share the story. We've spent so many time. Gadai is the work on the designs. Thank you so much, Gadai, and for the great work for putting all this together. It couldn't have been a success without you. Keep up the great work. I love the passion. I love the hard work. Congrats, Gadai, and all the best. Thank you. Then we have Ruth. Ruth, thank you so much for the passion. Thank you for the wonderful WOW webinars that you organized, and congrats on your graduation. And then we have Ibrahim Katarega from Barara 2. Ibrahim, keep up the great teamwork and all the best. Congrats on your graduation. And then we have Patricia Ajeru. Patricia leading the Student Network Organization in Uganda. Keep up the great leadership, Patricia, and I'm sure that we'll get to, have these different, organizations, student network organization, the medical organizations, and all other students organization coming together and championing the work for AMR. Congrats, Patricia, and all the best as you continue championing for AMR and engaging in leadership work. Thank you so much. Then we have Wekoye Elizabeth from Makerere. Thank you so much. Very patient and very kind young lady. Congrats, Elizabeth, and all the best. And then we have Wanjiru Mwangi from Mount Kenya University in Kenya, another hospital in Kenya. So much passion we go into where nobody gets to analyze the situation for us. And congrats so much, Wanjiru. Just the beginning. Congrats on your graduation. And then we have Warren Abraham, another patient, young person from Uganda, Mbarara 2. Warren, thank you so much. And congrats on your graduation. Thank you always for being among the, the first people to always share everything and keep up the commitment. Congrats on your graduation. And then we have Nankia Shanita from Mbarara 2. Shanita, congrats on your graduation and keep up the great teamwork. And then we have Chikwe Monsa, all the way from Zambia, Copperbelt University, along with keep up the great work there. At least I'm sure we have some great work going on there, along with Ignatius from Zambia too, Copperbelt University. Congrats, Chikwe, and keep up the great work. Yeah, so Julian, maybe you can take us over to the next list of students. Yeah, thank you so much. Over to you, Julian.
Thank you so much, Daniel, and congratulations indeed to the students and for all the great work that you have done and for the commitment. So now we do have a total of 91 students that were graduating today, but some of them did not manage to then send us the photos because they had exams and other pressing commitments in their institutions, but they did attend the sessions. All the ones today attended, they managed to submit the assignments as we highlighted at the start. So I'll just display their names for the other ones that we are not necessarily taking through this acknowledgement of the photos and all. We have Emmanuel from Nigeria, Ladoke and Kintola University of Technology, and we have Aleko Timothy from Barara University, Mercy Arindange from Barara University too. We have Sheila Barayaka from Barara University, Samuel Dauke from Barara, Jonah Uimire from Barara, Peter Kalemba, Kampala International University, Felician Kazarua from Kampala University, Esther Komkea from Barara University. We also have a Francophone, a very passionate AMR champion all the way from Ivory Coast, Ibrahim Kuma. He has been very committed, and although we had issues with translation during our sessions because we're mostly using English, I'm sure he managed to learn quite a lot of English in the sessions. So congratulations to you as Julius Koma from Barara University, Alan Nyeko from Makerere University, Tanaka Masiwa from University of Zimbabwe, and Rogers Mohangi from Kampala International University, Samuel Muhia from the University of Nairobi. And we also have, this is the last slide of the students, and I would want to congratulate Isaac Muno from Makerere, Emily Musineta from Barara, Mutembi Mwanga from Maradi University. This is actually all the way from India, where he's actually having his degree, but he's originally from Uganda. Alex Nawera from Uganda, School of Psychiatric. He's actually doing. He's actually under the School of Psychiatric clinical, he's a clinical officer actually. Yeah, that's what it's saying on the list. And Nankaya Sanita from Barara University, Winnie Nyaiga from Barara University, and Elisha from Busitema University, Emmanuel Abraham Opio, Kampala International University, Busitema University, congratulations to Kennedy Pangoli. We also have Paul Island from Tanzania, and Rotich Edna from Kenya, here at Karamogi Odinga University of Science and Technology, Elvis Tamale from Barara University of Science and Technology. We have Brian Tumskie from Makerere University. He did a very good presentation of summarizing the silent tsunami costs that we talked about from the React website during our group discussions. And then there is Len Morada from all the way from the southern part of the continent, Harare Institute of Technology in Zimbabwe. So congratulations to all of you. And this is really exciting, as we said, that to see all these young leaders being so committed and championing AMR is very encouraging. So now at this juncture, I'll hand over to two of our students, as Daniel had mentioned in the beginning. We do have two students that will give us some vote of thanks. And then we'll move over to have Daniel give a few remarks on behalf of Students Against Superbugs. And we'll end the session with our director, Dr. Murphy, officially closing the event. So now I will call upon the first student from the southern part, Copperbelt University. I'll call upon Ignatius Kembe Salachi. He's from Copperbelt University in Zambia, to give us just very few remarks as he gives a vote of thanks indeed to our guest speakers and to all the participants that have been here today. So over to you, Ignatius, for a few remarks.
Thank you very much, Julian. Good afternoon, good evening, everyone. Hope you're able to get me. Hello?
Yeah, we can hear you loud and clear.
Sure. Thank you very much. I would like to say thank you for this privilege to have been asked to propose a vote of thanks on this memorable occasion. And I would also want to also congratulate my fellow graduates on this memorable occasion. Indeed, it has been a long journey, and we thank God we've reached that this far. I would also like to extend my thanks to React Africa and Students Against Superbugs Africa, and also on our valued invited guests, the ladies and gentlemen. Also, a big congratulations once again to my fellow graduates for this momentous achievement. And also want to give gratitude also to our moderators, Daniel and Julian, for doing a very good job and making this event a success. Thank you very much.
Thank you so much, Ignatius, for those remarks, and thank you for the commitment. He was always one of the first students to log into the sessions every time and hardly missed any. So we'll also have Michelle Mayuba from University of Nairobi here in Kenya, who was supporting us a lot with rapporteuring the sessions, as Daniel indicated earlier. So Michelle will give you a few minutes to give a vote of thanks.
Hello, Julian. Unfortunately, Michelle has had a technical issue.
Okay.
With so I'll just do it on her behalf. She has really tried. She's even on call with me at the moment that I've just told. It's okay, Michelle. You just relax. We really appreciate your video. But it's due to a technical hitch. Yeah. So once again, as Ignatius has said, I really love to thank especially React Africa. Start with there for really taking it serious and engaging students. It's not many organizations that come up and really invest in students. Not many, I'm sure some of us have seen, and I really appreciate that since the time that we met the first time with Julian and Muffin, at least we've engaged so much, a lot of productive work, a lot of impact. And I'd also love to thank our speakers, our guests who also facilitated the sessions, including our guests today who also graced the event. We do not take it for granted. We know that you are very busy people with a lot of commitments, but sparing that 1 hour, 2 hours, 3 hours to be with us, it really means a lot to us. And also to those in absentia, we have those silent people who support silently, professionals too, giving advice here and there, giving mentorship here and there, without even wanting any recognition, just supporting silently. We thank them so much in absentia. And I also want to thank a great team that has been there with us, supporting me and Julian. And starting with Gadai Mundia, as I said before, Gadai is the one who has been in charge of like designing all these flyers and everything, ensuring that we even have a good branding for the AMR program. Yeah, thank you so much, Gadai, for always taking your time, for the passion. We appreciate doing the best that you do. Michelle too, who is not able to join us at the moment, was to offer the vote of thanks. Michelle has always been there, doing the reports for the session, assisting in the rapporteuring, and over to Anastasia too, who was also supporting us, and all the other students who have supported in one way or another. And I would want to also offer a special gratitude to all the students that are graduating today, because it's not everyone who started the journey who finishes, but you have been very consistent. And I'm sure some of you are finding it hard, juggling your classes, going and doing some of these activity. I can admit that the program has been quite intensive. Yeah, and at least you showed the commitment, you showed the tolerance to like hold on during until last minute, and even coming up with ideas and just anything, just all of you. And as Julian has said, is just the beginning. As I typed in the chat box, we are not going anywhere on our AMREP. You've just now transitioned to AMREP Cohort 1 alumni. We are not closing the group. Discussions continue as usual. As Julian mentioned, we'll also have another session, an intensive session where we'll share more about the program. And we'll also have like a good forum where you can still champion and share some of these activities that we have so much that is coming. We have the 2022 project proposals. Some are very good, very scientifically written, and very well written. And at least you can see that you incorporated all the learnings that we had in the session. We don't take that for granted. Doing all those, some even 10-page, 10 plus, 20 plus reports, and we really do appreciate you taking your time and engaging this much. The different reflection essays that you have told you to engage in, the baseline, the end line, everything. We really do appreciate your support. And as I've said this, that's the beginning. We'll continue engaging as usual. Today was just a step and a milestone, graduating, but we have so much. And as I end, because I was also to offer the concluding remarks, I love to share with us the story of the hummingbird. And this story was told by one Nobel laureate. She was from Kenya, but her impact was felt throughout the world. And her name was Wangari Maathai, Professor Wangari Maathai, the first lady professor in Kenya. And Wangari Maathai was attending one session, and I think she was asked, why are you so passionate about, for her, she was championing for environment. And she really had to do a lot to put environment on the table. And some of you, there are some parks in Nairobi and many things. Some of these things, even forests that exist in local Kenya today, they are because of what she and her colleagues did. And so she said, for me, what motivates me is the story that is told of a hummingbird. And what happened is that in one day in the forest kingdom, there was a fire, and a very, very big fire that went viral, and all the animals were running out toward the forest to save their lives. And they were all running out from the forest, just going to the edges of the forest. And they were all desperate. The fire was blazing so ferociously, and they did not know what to do. Even the big animals like the elephants and the rhinos, the buffaloes, they just sat there watching, wondering what is happening? What is happening? We can't save anything. We are now homeless. But there was one little bird called the hummingbird. And I'm sure some of you know the hummingbird. It's a very, very small bird. And so the hummingbird said, I will take my responsibility. I will do what I can in the best way that I can, in my own personal capacity, So what did the hummingbird do? You know, the hummingbird is a very small bird. So it went to a stream that was nearby. And so it went, took that one
It
drop
looks
of
like
water.
we have lost Daniel at a very...
No, we can hear him. He's okay. We can hear him.
Hello, can you hear me now?
Go ahead, Daniel.
Okay, thank you, thank you. Oh, sorry. So I was sharing the story of a hummingbird, and so this hummingbird, when the forest was on fire, it was going to a stream, and just going to a stream and to the forest, taking a drop of water, rushing back to the forest, pouring that one drop, going back, pouring that one drop, back and forth, back and forth, back and forth. And all the animals were looking at the hummingbird and wondering, what are you doing? You can't quench the fire, you know? There's nothing that you can do. Those little drops of yours won't do any impact to this fire. But this is what the hummingbird told the other animals. For me, I'm doing the best that I can in my own personal capacity and what I have. And this is the best that I can, and I'll don't quench this fire. I'll be sure that I did the very best. Animals, you know, some of these. What can I also do? You know, animals like the elephant are there. With my big trunk, I'm just here watching the fire helplessly. And so today, as we wind up, this is my parting shot to all of us. Let's be the hummingbirds in AMR. You know, sometimes we just see that we are just students, we don't have so much, but always do the best that you can within your own personal capacity and within the resources that you have. And I am sure that you'll make an impact, because that forest fire eventually came to end because all the birds then came to follow about and were really challenged by the hummingbird, and they all engaged concertedly and quenched the forest fire. So our fire this time is AMR. Be the hummingbird, and I'm sure that we'll curb AMR at the end. Thank you so much, and I wish us the very best as we begin on this great journey of curtailing AMR in the African continent and globally. Thank you so much. I hope you are still hearing me. Hello.
We can hear you, Daniel. Sorry, I was having a technical challenge, but now I think I'm back on, so I can hear you loud and clear. So I was going to say I will not dilute the hummingbird story. Let us all go. Sorry, my internet is now a challenge as we are concluding, but I think it's now stable. Anyway, I was saying thank you so much, Daniel, for those concluding remarks, and I will not dilute the hummingbird message. Let us all really go, whatever small efforts we are doing, let's continue doing them. So at this juncture, I'll hand over to our director, Dr. Mefin Mpundu, to give us the official closing remarks as we conclude this exciting session today. Over to you, Dr. Mefin.
This has been one of the most exciting events and one of the most exciting days in the whole of this year. I mean, to actually see 100 students, to see, participation, over 80 people around the world joining us to really be inspired by the students, by what they learned, by what they did, by their engagement, by the way that they've taken on AMR as true champions and really influencing their sphere of influence in their own communities, on their own campuses, and to really see them get so involved and interested in solving this global issue or global pandemic that we have. So it has been very, very heartwarming for me to listen to your stories, to look at your growth and, really where we started from. It's been really heartwarming, and I wouldn't exchange that for anything. So thank you so much for also enriching my own life. When I look at you, I feel so encouraged, and I am full of hope that you know, the future is bright, and you know, we will be able to really contain AMR, and we will have another generation of great champions who will champion the great causes of you know, that we are committed to in this generation. So I want to say thank you to Daniel and to Saz and his leadership there. Daniel, you've been great to work with. You know, it's always a pleasure really partnering with you and partnering with your team. We look forward for continued collaborations. I want to say thank you to Julian, who has really led this program on our behalf. And, you know, we wouldn't really be where we are today without her commitment to this. I want to thank all the students. I want to thank all the partners, all the friends that have joined, and all the organizations in us the last 4 days, and especially today itself. Wishing you God's eternal blessings, that you guys will really continue to do well. Let's continue raising the voice. Let's continue with our passion, and let us indeed do our part. But that's all that we can ask, that let's do, each one of us do our part, and we'll be able to really preserve and ensure that the precious molecules that we have now can continue, and we can realize the vision of REACT, you know, to create a world where people will not be afraid to get an infection because they will not be treated, but they will get the infection, they will be treated, and they will be restored. Very much. And thanks to the interpreter, rapporteurs, the REACT team. I'm so thankful to each one of you that you made this a great successful REACT Africa and South Center annual conference. Looking forward so much. God bless. Bye.
Thank you, Dr. Methin, and bye to everyone.